and the Lead-Free Promise Project, and your host for today. Children First is the leading advocacy organization that improves the lives and opportunities of children in southeastern Pennsylvania. They do this by developing initiatives and advocating for quality health care, child care, public education, and vulnerable youth. In 2019, Children First launched the statewide Lead-Free Promise Project as part of the statewide Pritzker Early Childhood Initiative. The Lead-Free Promise Project is now made up of over 70 organizations and over 300 members in healthcare and health insurance, housing, social services, education, business, civic, community organizations, and families impacted by lead poisoning. In 2024, the Lead-Free Promise Project began a pilot project with the Pennsylvania Department of Health to provide technical assistance and support to communities most impacted by lead poisoning in children. My colleague Janet Panning, who unfortunately broke her shoulder last week and can't join us today, and I have been working with communities like Lancaster, learning what is and what is not working in case management, testing, lead remediation, education, and health. Lancaster, we learned, was a shining example of what can happen when a community bands together to address childhood lead poisoning. You will hear more about that later on this morning in the panel. Every year, thousands of children are poisoned by lead. We know that lead can cause serious harm to a child's health, impacting the brain and nervous system, causing slower growth, development to learning and behavior issues, speech and hearing problems, which can cause lower IQ, and decreased ability to pay attention and underperformance in school, often requiring special education services. Research also indicates that childhood lead poisoning is a risk factor for some criminal behavior in adulthood. For those of you who attended last night's networking event and saw the really impactful movement hitting it in the walls, which I had never seen before, it really tells the story of and the history of why we're here today. So I really encourage you, you can rent the movie to take a look and maybe share it in your community. The most recent data shows that 11,500 children poisoned in Pennsylvania, with many more children going undetected yearly, since only 20% of the state's children are being tested. Pennsylvania has the second highest number of children poisoned in the nation, and the fourth oldest housing stock. Lead-based paint hazards in children's homes are the main source of lead poisoning, with lead paint not being banned in residential use until 1978. 70% of the residential properties in Pennsylvania were built before 1978. And unfortunately, African American and Hispanic children are disproportionately poisoned because they are more likely to live in older properties with deteriorated lead-based paint. In PA, 4 times more Black children and 2 times more Hispanic children are poisoned than white children. The Lead-Free Promise Project goal is to simply in protecting Pennsylvanians' kids by ending lead paint poisoning by removing lead hazards in older homes and schools, and increase childhood lead testing with 2 tests by the age of 2 for every child in Pennsylvania. Our speakers and panelists and special guests will guide us through the strategies that we can improve case management, community education, remediation, and policy. We will have local, state, and national perspective on issues while keeping in mind the very real and often overwhelming impact that lead poisoning has on our children and families. And we'll just go. Go to the next one. So I just wanted to let you know that the Lead-Free Promise Project, we have a really amazing website, and I really encourage you to check it out. And we have lots of updated resources on the website. We have our toolkit, we have a fact sheet, we have the Pennsylvania lead exposure from fight crime and investing kids. We have a 6 steps handout for municipalities doing ordinances and a screening guide. We have 20 county fact sheets for the most impacted communities in Pennsylvania, and more resources are coming, so we really encourage you to check out our website. So let us begin together by becoming empowered to make the necessary changes to prevent childhood lead poisoning in Pennsylvania. And now I would like to introduce Michael Barber, who is the Chief Operating Officer, the interim CEO for Penn Medicine Lancaster General, and has been working in this role since effective of July 2025. Mr. Barber.
I was hoping that my mugshot would be up there, but it's okay. I have to look at it. Good morning, everyone, and what a very impressive group that we have here from across the state, and also from our guests from New Hampshire, who I met earlier when I came in. So it's also a privilege to welcome you all to the Empowering Change Strategies for Lead Safe Future Conference here in Lancaster County. This community, like many across the state, has been working tirelessly to tackle one of the most pressing public health issues facing our children today, which is lead exposure. As the interim CEO of Penn Medicine Lancaster General Health, I'm proud to say that our work in this area is not just in theory, but it's real, and it's making a difference. Our Lead-Free Families program, which we launched in 2021, has already remediated over 700 homes, making them lead safe for families. Making them lead safe for families who no longer have to live under the threat of lead poisoning. Each of these homes represent not just a house, but a safe place for children to grow, play, and strive, now and for future generations. These homes will continue to be a sanctuary for new families, ensuring that future residents are also protected from the dangers of lead exposure. This success hasn't been achieved in isolation. Our work is rooted in collaboration. I want to take a moment to highlight the incredible partnerships that have made this progress possible. The City of Lancaster, the Green and Healthy Homes Initiative, and the Lead-Free Promise Project. The City of Lancaster has been a critical leader in the fight against lead poisoning. We are grateful for our strong partnership, which has allowed us to put the needs of our neighbors first and work together with a shared sense of purpose, from policy support to community outreach. The city has been an invaluable ally in ensuring that families have access to essential lead remediation resources. Their leadership in prioritizing this issue has been instrumental in the success of collective efforts. Another key partner in our work is the Green and Healthy Homes Initiative. Their expertise was instrumental in helping us build a successful program. And their ongoing support allows us to remediate approximately 200 homes each year. Our 4 team members based in Lancaster office work closely with clients and staff every day, playing an invaluable role in our efforts. We are also deeply grateful for the knowledgeable leadership from their Baltimore team, whose guidance continues to strengthen and support this important work. And of course, a big thank you to the Lead-Free Promise Project for coordinating today's event. Their work in setting the stage for policy that ensures a lead-safe future and dedication to gathering like-minded groups to advance lead prevention work is outstanding, and we're grateful for their partnership. To everyone in this room, healthcare providers, public health advocates, community leaders, thank you. Your collective work is making a real difference, and today is about celebrating that impact while continuing to learn from one another. The challenge of lead exposure is complex, but it's not insurmountable. We know that this is not a problem any one organization or community can solve alone. That's why this conference is so vital. It's an opportunity to share best practice, reflect on successes, and even acknowledge where we can improve. The work we're doing here in Lancaster is just the beginning, and I'm confident that together we can expand our efforts statewide and create a lead-free future for all children. Before we dive into today's sessions, I'm excited to introduce a key advocate in the fight against lead exposure, someone who has been instrumental in supporting public health initiatives in our community, Commissioner Yoder. Her leadership and commitment to improving children's health has been invaluable, and we are thrilled to have her with us today. Alice Yoder was elected Lancaster County Commissioner in November of 23. Prior to this role, she served as the Executive Director of Community Health at Penn Medicine Lancaster Health. Welcome, Alice, to the stage.
Well, good morning, everyone.
Good morning.
So happy to be here and appreciate the invitation to speak and be part of this amazing group of people. So I wish I had more time to go around and talk to a lot of you. I know you're here from lots of other counties and we can learn from each other. Unfortunately, after I speak, I'm going to have to leave, so please don't take it personal. I'm curious to hear how things go during the conference and learn more about that. But really excited to look around and see people from a variety of backgrounds. But as I said, welcome to Lancaster. And one of the things I wanted to do for those of you that are not from Lancaster is to share a few fun facts about Lancaster County. So first and foremost, Lancaster County is a county that has lots of Amish. Surprise! We are the largest county that has the most Amish in our community. However, so you won't be surprised as you're driving around our county that you'll see a horse and buggy on the same road as a Tesla, all at the same time. We are the 6th largest populous county in the state. So although we seem like we're a rural county, we're not. We're considered a mixed county. So that means we have an urban core, suburban ring, and then we are also rural, even though people do think about Lancaster County, they think about Amish. But there's more to Lancaster County than Amish as you drive around. And of course, when you hear about the great work that's being done in a collaborative way here. We have some of the most richest and most productive soil in the country here in Lancaster, and we really have worked hard on preserving farmland, open spaces to maintain that rich culture that we have here as well. We are ranked first in farmland preservation by any county across the nation. So that's how much we value that. We're at the point now where we're thinking about how do we balance farmland preservation with affordable housing and growth, because we are one of the few counties in the state of Pennsylvania that are continuing to grow in population. Another little fact is on September 27th, we served as a capital of the United States for a day. A little bit tricky, so you can write that down and share that with people. What did you learn from the conference? Hopefully, I think there'll be more than that. But we did serve on September 27th, and that was when the Continental Congress fled Philly during the Revolutionary War. And then a couple of key other trivia notes about Lancaster County is we have approximately 98,000 homes that were built before 1978. And that was a lot of what was taken into consideration as our community went forward with the coalition and thinking about what could be done around that. And I would also like to add my own personal piece of trivia is I think Lancaster County is one of the most collaborative counties in the state of Pennsylvania, which leads to a lot of our success. So before serving as county commissioner, well, let me back up a little bit. Since I've been serving as county commissioner, finishing my 2nd year, I'm just in awe of understanding the impact of lead. I was director of maternal child health for 4 years, so I understand the impact that it has on children. Also oversaw a program called Healthy Beginnings Plus, Nurse Family Partnership. Some of that staff is here today, and they know what the impact of their families and what lead has on the work that they're doing. So that's significantly important. So now that I'm in the role of county commissioner, and I oversee departments like behavioral health, developmental disability, children and youth, office of aging, and with aging individuals, I've been to some of their homes. They take care of the grandkids in their homes. So I continually, on an ongoing basis in this role as county commissioner, see firsthand the impact of the importance of remediating lead exposure for those youth in these programs. Also, as a county commissioner, I oversee the prison and the Youth Intervention Center, which again, the connection between lead poisoning and the juvenile justice system and the criminal justice system as well. So in this new role, it's still really apparent to me the importance about the work that's being done by many of you, and I know there's still a lot to be done, but I just wanted to point that out. But before serving as Lancaster County Commissioner, I spent several decades as the Executive Director of Community Health at Penn Medicine Lancaster General Health, as Michael had pointed out. That department focused on addressing a wider range of health issues, always with an emphasis on upstream primary prevention. Over and over again, I saw how the biggest difference came not from treating illness after it happened, but from preventing harm before it occurred. Back in the early 2000s, we started the Lancaster County Childhood Lead Coalition. The coalition provided education programs, increased education lead screening, but the coalition always had a strong message that we need to fix the home. Screening was secondary prevention. Primary prevention is to take care of the home, because it's the home that's sick and making the child sick. And that was always the focus years ago, and looking for a way to try to solve that. And when we talk about childhood lead exposure, prevention is not only the most effective strategy, it is the only moral one in my mind. At first, it seems like common sense, almost a no-brainer. Of course, we can keep children safe from dangerous toxins that can alter the brain development, their health, and their future. But as we know, history and practice has shown that it's not always easy. The temptation to often focus on treatment or a response after the child has already been poisoned. Yet, research has made it clear for years, primary prevention, keeping lead away from children in the first place, is the best and most effective path. Here's the most important lesson I've learned. None of this can be achieved by one person, one agency, or one sector working in isolation. It requires true collaboration. In Lancaster, we've seen what is possible when health leaders, local government, community organizations, landlords, and residents sit at the table and with a shared vision. The vision of a community where no child's life is altered by something as preventable as lead exposure. That a collaborative spirit had made progress possible, turning what once felt like an overwhelming challenge into a collective effort where everyone's role plays a vital part. And the beauty of collaboration is that it multiplies impact. When one city strengthens its housing codes, it provides a model for others. When one nonprofit engages residents in lead safety, it sparks ideas that other communities can adopt. When state and local leaders align resources, we accelerate progress and avoid duplication. Coalitions and collaboration ensures that each effort adds up to the more of the sum of its parts. So 2 + 2 = 5, and at many times even more. That's why today's conference matters. Bringing together voices from across Pennsylvania creates space for us to learn from one another. You all have lots to share in terms of experience and successes. To share those strategies that work and build stronger statewide movement. Because while lead poisoning is a local problem, in its effects, it's statewide challenge in its scope, and it will take all of us working together to solve it. I'm grateful for all of you for your commitment to this work, and I know it's been many years. As I look around and have greeted some of the people here, we go way back, way before my time of being involved in this initiative as well, and glad to see those champions still sticking around to carry the mantle to move this forward, and lots of new young people that are really motivated to get some things done. So I really appreciate your expertise, the partnerships, your persistence are what makes Pennsylvania a safer, healthier place for children. Let us continue to collaborate. Let us continue to innovate, to think about things that are new, to challenge what we've been doing, and to come up with new ideas that still get us to the vision that we want to share. And let's hold ourselves accountable to this vision of a lead-free future, because when we do, we not only protect the health of our children, but we also strengthen our communities for generations and generations to come. And I thank you for all of that, and thank you for allowing me time to speak. And now I have the great honor to introduce Dr. Robert Bonacci, is Special Advisor to Pennsylvania's Secretary of Health. In this role, Dr. Bonacci provides high-level clinical and public health leadership and expertise, focusing on enhancing the public health impact of the Department of Health's programs and policies. Before he joined DOH, he served as the medical officer in the Division of HIV Prevention and Control of the CDC. And he's a lieutenant command. He was a lieutenant commander in the United States Public Service. Please welcome Dr. Bonacci.
Good morning, everybody. Good morning. It's great to see so many faces in the room. I just want to start by sending my regards from Secretary Bogan, our Secretary of Health here in Pennsylvania, and her thanks and our thanks to the department for all of the work that you all do to ensure a healthy Pennsylvania for all and to ensure that we reduce the impacts of lead exposure across the Commonwealth. It is again a great pleasure for me to be here with you all this morning. It's a beautiful morning. It's a little bit crisp outside. But I'm really excited to talk a little bit more about the lead prevention efforts at the Department of Health and the different programs that we have and the different programs that we support across the Commonwealth. So I'd like to give you a little bit of an overview of some of those programs. But first I'd like to share a little bit about the epidemiology of lead poisoning across the state, to share some preliminary data that we have. But also it's important, because this is an important public health problem. Lead exposure, lead poisoning, especially in children, given its impact at such an early age, is really important to be thinking about how do we mitigate, how do we reduce. I appreciate Commissioner Yoder's comments about prevention being imperative. It's essential that we stop it before it happens. I mean, obviously we want to be able to diagnose and recognize clinically when a child is experiencing symptoms or negative neurologic or developmental outcomes as a result of poisoning, lead poisoning, but in the ideal setting, we prevent it from happening at all. And I think that's the goal of everybody here in this room, and appreciate all the work that you all do to that end. So as I mentioned, I'd like to share a little bit about the epidemiologic situation here across the state. Normally, if you go to our website, if you Google search, the Department of Health lead surveillance, we have within our Bureau of Epidemiology, we have lead surveillance reports that we release annually. The 2023 report, from 2023 data, is not yet up on the website, but that's what I'm going to share some data from now. So most recently, you can see the 2022 report. But what we see in 2023 is that more than 175,000 children between the ages of 0 and 15 were tested for lead in that year, with nearly 195,000 tests done. So it was 175,000 approximately unique children tested, some who received more than one test. And these are all reported to our surveillance system at the state, because every blood lead level test is required to be reported to our surveillance system at the state. Among children under 2 years of age, we see that 35% were tested in 2023. And among children less than 6 years of age, we see about 21% of children were tested in the same year. A little more than 10,000, so about 10,500 children had an initial capillary test that was greater than or equal to 3.5 micrograms per deciliter, which is the threshold we recommend for, or threshold that's recommended by CDC to be considered an elevated blood lead level, and for which you would want to pursue additional confirmatory testing if it's the capillary blood test. What we see of those 10,500 kids is about 60% of them got retested. And so there's a gap there. There's 40% of those individuals, of those children, didn't get retested who were indicated for a test. And so, to me that indicates it's a systems problem or a systems failure. So somewhere in our systems, in our clinical and public health systems across the Commonwealth, there are children who are falling through the gap, who we know may have an elevated blood lead level in reality, but who aren't getting that confirmatory diagnosis. Among children less than 2 years of age, we see that 3.5% of those tested ultimately had confirmed lead levels greater than 3.5 micrograms per deciliter. And that is equivalent to about 1.2% of the population of children who are under the age of 2 in the Commonwealth of Pennsylvania. So about 1% of our children across the Commonwealth have a confirmed blood lead level that is higher than what's determined to be safe. And so comparing to the 2022 surveillance report, which again is available on the website now, we do see some positive news. We see a slight increase in testing trends, and that is true if you look back over a number of years. We see test percentages, or the number of children being tested, slowly increasing over time. We also do see in this last report a slight increase in the rates of children confirmed to have blood lead levels greater than 3.5. And so again, that means we're doing a better job or improving at making sure we're getting those confirmatory tests for children. But as I said before at the beginning, there's still a large gap in terms of making sure kids are getting the needed testing. The department's also been working on, so one of the limitations of our annual surveillance report is that it looks at a slice in time. So it looks across just 1 year. And so if a child was tested before that year, then that's not captured in the data analysis. And so our Bureau of Epidemiology has been doing some additional analyses, what's known as a birth cohort analysis, and I won't go into too much of the technical details, but just to share that it's a way of looking at the testing data. So what it does, or what this report is going to do, is it looks at the birth cohort for children born in 2019 and 2020, and it looks over their first 2 years of life and then says, what is the testing data for those kids. And then they were able to compare that to prior birth cohorts, again, to see what the trends are over time, if there are gaps, are we improving? And like other public health problems, this is really how we monitor the work we do at the Department of Health. And so what we see in that is that among kids born in the 2019 and 2020 age cohort, 58% had blood lead level testing before the age of 2. So that's actually a little bit better than what we see in the 2023 surveillance report. And again, some of that may be related to data limitations in the study design of the surveillance reports, which tend to underestimate the total number of kids tested, because again, it's only a snapshot of the year prior. And we do see, so I said 58% in that age cohort had testing, and that's an increase from 48% 5 years prior in the 2015 birth cohort. The other caveat I'll add there is that, as you are all well aware, 2019-2020 birth cohort also coincided with the most significant health pandemic or health epidemic of our lifetime, which dramatically changed access to healthcare, access to public health services across the Commonwealth and across the country. And so I would like to think that as we come out of COVID, that some of those testing numbers may even increase beyond what we see in the report, because that was happening in those first 2 years of life when people weren't able to go to the hospital, when procedures at health departments were different than they'd usually be. And so I'm hopeful that when we're able to reanalyze future data, that we might see even more improvement on those numbers. One thing we also know is geographically, the testing rates and the positivity rates vary significantly by where you live in the Commonwealth. And we see this across a number of health conditions, and I'm sure this is no surprise to folks in the room, but where you live determines a lot about your health and the future you are likely to live. And so we see testing rates vary significantly by county across the Commonwealth. But one thing I would note is they seem notably low in some of our eastern counties. And so I think that helps us figure out where we need to work to do better education, through our public health education campaigns, through direct outreach with clinicians to educate them about, lead testing recommendations. And so that is one area, I think, in the eastern part of the state, we do see a little bit lower testing rate across the counties. Now that I've shared a little bit about some of the recent epidemiology and some of our preliminary data from reports that you'll see hopefully come out in the next couple of months, I'd like to share a little bit about the programs we have for lead prevention at the Department of Health and the work we're doing. And again, none of this work, some of the work happens exclusively at the department, but largely, as you'll hear in the programs, it's about collaborating or contracting with other partners, grantees across the Commonwealth. And so we really appreciate the work that you all do to carry out the mission of reducing childhood lead exposure across the Commonwealth. So I'm going to share a few programs. The first that I'll speak about is our Childhood Lead Poisoning Prevention Program, or CLPPP. And this is a program funded by the Centers for Disease Control and Prevention. They fund programs across the country like this. We have about a $600,000 a year budget. And we have 6 grantees who help implement this program. And the goals of the program are really to strengthen blood lead testing, strengthen reporting of those test results, and then strengthen surveillance, the work we do at the health department. Additionally, the grant supports efforts to link exposed children to recommended services. So once children have had that confirmatory test, making sure that they're linked to other appropriate health services, whether it's clinical care if they need their lead levels acutely addressed, or being able to have an inspector come to their house or wherever they live to see what the potential exposure is, and then ways to reduce or mitigate that risk. Similarly, the grant supports targeted population-based interventions to prevent lead poisoning. And finally, the last goal of the grant is to provide awareness and education of communities, to healthcare providers, and to stakeholders across the Commonwealth. The next program I'll share about is our Lead Hazard Control and Healthy Home program. This is a program, so as you'll notice a common theme here is that, like much of the work we do in the Department of Health, a lot of our funding comes and flows through the federal government, comes to us at the State Health Department, and then either we use that towards programs of the department, or we distribute it across the Commonwealth or to our local and our county and municipal health departments. And this program is no different. It's funded by the U.S. Department of Housing and Urban Development, or HUD, as most folks know it as. And this funding supports the reduction of lead-based paint and other home hazards. It also funds the training of lead-certified workers to increase capacity across the Commonwealth. Unfortunately, this funding expired in March of 25, and we currently have an application in for the Notice of Funding Opportunity, or NOFO, but we're waiting to hear back on the results of that grant. So at the moment, we don't have any funding for this program any longer, but we are hopeful. We're hopeful that we'll hear back. I think part of the delay may be related to the current shutdown at the federal government as well. And then we have funds from ARPA, or the American Rescue Plan Act, and these are more time-limited funds. So this is a program that over time isn't going to be recurring in nature necessarily, whereas the programs at CDC and HUD are usually reappropriated annually. And so that funding was allocated to Pennsylvania for lead hazard control work and for workforce development. So some similar goals to the program immediately prior that I described. And we've been working with 18 grantees across the Commonwealth to conduct lead hazard control efforts, and again, to train more lead certified workers. That funding runs through December of 2026. And this was some of the funding we were able to use through advocacy efforts of the Lead-Free Promise Project. We had been awarded $10 million in ARPA funds to achieve some of those goals, and so we appreciate partners for their advocacy to ensure that Pennsylvania was able to access those funds. And it has helped to increase the number of homes that are made lead safe here in the Commonwealth. We also have environmental lead investigation programs. So we provide a service to eligible families who have a child in the home who has a blood lead level greater than 3.5 micrograms per deciliter that I mentioned. And we fund 2 grantees across the Commonwealth to provide these services, and it covers all counties across Pennsylvania. And those are also funded similarly through ARPA funds, and so currently those programs are set to run through the end of December of next year. We also have a lot of informational resources that we make available on our website. And so again, if you Google, I don't have slides with me here for you to see, but if you Google Pennsylvania Department of Health lead poisoning or lead surveillance, it'll direct you to our 2 primary lead pages, lead-related pages, and that's where we have a number of resources along the right-hand side of the page that you're able to access, that you're able to share with community members and organizations. We maintain a lead-free information hotline. It's 1-800-440-LEAD, L-E-A-D. And that hotline provides information to anybody who calls about lead poisoning prevention, testing, follow-up, and local resources for assistance can be accessed by families, parents, community organizations, clinicians, anybody who has a question about lead poisoning or lead prevention. And again, as I mentioned, our website is a great resource as well. And then certainly the Centers for Disease Control and Prevention have a lot of lead resources on their pages as well. The other thing I'll note there is that there's links on the webpage to brochures and posters, sort of informational things that you can print out, post, hand out as well about lead poisoning and lead poisoning prevention. And then there's the Lead-Free Promise Project. And so the Bureau of Family Health has been collaborating with Children First to provide services related to lead poisoning education and awareness. A care coordination pilot program which aims to address the lack of coordinated services for children with elevated blood lead levels. And it strengthens the efforts of the Lead-Free Promise Project. And so that's one of the things that brings us here today. I think the Bureau of Family Health has been funding Children First since 2024 for this. And As I mentioned, we also have the Bureau of Epidemiology, and so they don't focus only on lead, but they focus kind of on all notifiable and other conditions of public health significance across the Commonwealth. But lead is certainly one of the areas that they focus on, that they do specific analyses in. As I mentioned, all blood lead level results get reported, or I should say, all blood lead level results are legally required to be reported. Whether they all get reported or not is different, but I think we have pretty high reporting across the Commonwealth. And so if a child's under the age of 16 and it has been tested, that is required legally to be reported to the Department of Health. We use our surveillance system called PA-NEDS, which is the PA National Electronic Disease Surveillance System, that collects and stores all of that testing information, the results, if somebody has a repeat test, and that's where we're able to do these surveillance analyses that I referred to in our earlier reports. And I should note also that the data we have at the department can be made available to other organizations, to in particular local health departments, and if there are researchers who are interested in using the lead data, depending on the scope of the request, the type of identifiable information used, the department can enter into data use agreements with health departments, with researchers, and so that data is an asset that is available. There are, obviously we can't just hand out the data sets as is. There are not only laws, but sort of there's research, there's ethical research restrictions around the use of the information. But it is a resource that's available to folks across the Commonwealth, and one we want folks to know about. And so if anybody's ever interested in trying to access that data, you're able to reach out to us at the Department of Health. Our Bureau of Epidemiology is happy to have a conversation and sort of guide folks to either using there's a data request application form, and then if you have questions that are sort of beyond the scope of the application form, folks can engage in a conversation about what data you're interested in obtaining, and sort of the format and ways we're able to provide that. I see Dr. Martin and Pringle. We were on a conversation a few months ago now related to data at the Department of Health as well. So. And then we have, as I mentioned, those programs are largely housed in our Bureau of Family Health. We also have our Bureau of Community Health Systems at the Health Department, and that bureau runs our state health centers, of which there are 59 across the Commonwealth. We serve 60 counties, and they're in almost all of the counties where there is not a county or municipal health department. We have 11 county municipal health departments across the Commonwealth, so there is some overlap where there are state health departments in those counties, but for the most part, you can think of the state health centers as being in places where we don't have those county or municipal health departments. And at those state health centers, and if you don't know where your state health center is, I'd recommend that you familiarize yourself with it. You can go again to our Department of Health website. If you Google Pennsylvania Department of Health state health centers, we list the address, contact information for every single state health center we have. But at our state health center, we have community health nurses who help to provide education to families and patients, and help to provide referrals to families who have a child with an elevated blood lead level. And so again, any elevated blood lead level that comes into our surveillance system for a child that's above 3.5, our community health nurses are aware of those children and work, again, because they're scattered all across the state, are working in their local area to make sure that children are connected to referrals and resources related to that testing. We were able in the northeast of the state, we did have some pilot funds for a short time where we were able to implement some lead testing actually through the state health center itself. They were going out to the local schools to make sure that they were either testing newly children under 2 or children who hadn't previously been tested who should have been, or kids who had an initial blood lead level that was elevated and then needed a confirmatory test. They were able to send that to our lab. And so the Bureau for Family Health, our Bureau for Community Health Systems, and other bureaus across the health department all partner together and meet quarterly to talk about different lead initiatives at the health department and to discuss different challenges and opportunities moving forward, ways to shift the focus of our programs to make sure that they work better. And so, in addition to those services, I'll just generally speak about the state health centers as well, because I think they are one of the things about the health department that people really don't know very much about, and they're everywhere, but they're accessed, I think not, in some places they're accessed quite heavily. Lancaster here is a little bit busier health center for sure, but in other more rural parts of the state, they're not necessarily as busy. So in addition to the lead health education and referral services, they're able to provide vaccines for children who are underinsured or who qualify for the Vaccines for Children program, for adults who are underinsured. They also have services like HIV or sexually transmitted infection testing. And then they do other health education. They provide naloxone. So for anybody who's at risk of opioid overdose, they provide this for free. And then they have gun locks and provide other health education in the community. They're often in partnership with their local schools, will often do education-related things that are focused on issues of public health importance. And so just a little plug for our state health centers. Our community health nurses work really hard across the state and would love to make sure that all of our state health centers are busy and being used to the fullest extent of their resources as well. And then in terms of universal testing, so as you all are probably aware in this room, in 2022, the Pennsylvania Childhood Blood Lead Act was passed. And that took effect at the beginning of 2023. And so that provides for blood lead assessment and testing of certain children and pregnant women by healthcare providers. The act establishes that healthcare providers shall consider possible lead exposure in individual patients and pregnant women by evaluating their risk factors for exposure. We do know that universal lead testing is essential for efforts to increase lead testing and to prevent lead poisoning. And so that bill didn't quite get us to universal lead testing, but there is another bill that's in front of the Senate in this session, and that's Senate Bill 850, that would require the testing of all children in the Commonwealth by 2 years of age, so that prompt diagnosis and treatment, as well as the prevention of harm, are possible. I believe it may also have some language about if the child hasn't been tested before 2 years of age and you see them between 2 and 6, making sure that they're tested then. And so, that's another thing I think that we're following in the legislature, and which certainly would impact the work that folks in this room do and the work that we do at the Department of Health. I think the evidence is clear that universal testing has benefits, and it helps us. Again, when we think about the cascade, I come from an HIV world. That was where my previous training was, and we talk about the care continuum for HIV, and so we think about from the point of diagnosis all the way through treatment and all the steps in between it takes. And I think you can think of similarly, there's a cascade or a continuum of care for children with lead, and that starts at the beginning on the prevention end of the spectrum, and that ends all the way with making sure once you've identified a child with lead poisoning or elevated blood lead levels, making sure you're getting their treatment. But at the beginning, it's very important to make families and children aware that they may have potential lead exposure. And so making sure we get all of our children tested is really important. There's certainly a number of challenges that we face, I think, in this space. Pennsylvania is not unique, but certainly among the states with a much higher stock of housing that was built before 1978, before lead paint was banned in homes. And so by virtue of that, we have children and families all over the Commonwealth that are perhaps unknowingly exposed to lead in their home environment. And we know that children under 6, and especially children under 2, I have a 3, almost 4-year-old now, spend a lot of their time on the ground, crawling with, my son Luca has got his hands in his mouth constantly, whether he's got dirt on his fingers or dust or whatever. And so we know that for families who are living in homes before 1978, and for those kids who, again, spend most of their time very close to the ground, to dust, to soil, their exposure is higher. And so that's one of the challenges we face that's unique here in Pennsylvania. We also have lower testing rates than we'd hope, as I mentioned before. In the most recent 2019-2020 birth cohort, we saw that a little more than 50% of children under 2 had a test. And so if the goal is to get everybody tested, we still have another little bit less than 50% to make sure that we're testing. And then again, to reinforce that for folks who do have an initial screen that's positive, we also have a gap in making sure that we're getting confirmatory testing done as well. We also have limited lead hazard control services in Pennsylvania, and especially in rural areas. I think, so I'll be with the Secretary at a Rural Health Summit on Friday. We've been hosting these regional Rural Health Summits along with the Department of Human Services and other state agencies. And the challenges that rural areas face with regards to lead are similar to challenges in health access that are being faced in other areas of healthcare. And certainly lead is no exception in that regard. It's for some families, we hear it is difficult to find somebody to come out and do the inspection. I think one of the things we commonly hear our state health centers when they're working on those referrals and follow-ups with children who have elevated blood lead levels. For folks who are renters, they're concerned about, well, what happens if I ask my landlord to have a lead inspection done? What might my landlord do? Will he renew the lease? He or she renew the lease? And so I think those are some of the other challenges we face in addition to not having enough folks to do the certified lead inspections. And then the shortage of contractors for lead hazard control. So not only the inspection piece, but the abatement and mitigation piece as well. Once we identify that there's lead exposure at a home, there's certified contractors who are able to come and help do renovations, lead abatement, mitigation. We don't have enough of those across the state, so that's why some of those grants that I was referring to, some of the ARPA money and funds are working towards training more individuals in those regards. And then there's certainly federal and state funding limitations. We see across the Department of Health and across the federal government, again, we see cutbacks in government funding that are impacting public health programs across a wide variety of domains. Our state health department is not unique. This is a challenge facing health departments across the country. And so how do we operate and how do we move forward in an environment where we're not receiving the same level of federal funding to support efforts across the state, both at the state level and then again as it funnels down to grantees and to our county municipal health departments. So I think those are just some of the challenges that we face in the work that we're doing. We're really appreciative of the work that you all do. I know, I think one of the things I was excited to see so many folks here, it's a great commitment on behalf of your communities, and you all are great assets to your communities, to be doing the work that you do, to helping to reduce the exposure of children to lead. Again, in terms of the challenges, we also as a state, not only was our housing stock largely built before 1978, but we have a lot of the major industries in Pennsylvania are such, particularly in the west, and then kind of along a sort of diagonal line along the eastern side in the southeast, are industries that increase environmental lead exposure for folks who live in their communities, and you can't choose where you live in some sense, and so it's difficult again it's difficult to pick up and move to a different place, but again, I think the importance here is being able to recognize, get that testing, and then making sure we're doing what we can to mitigate exposure and to mitigate lead poisoning. And so I know the Secretary really wanted to be here with you all today, and she sends her both apologies that she can't and her regards, her appreciation for the work you all do. We appreciate the great partnership with you all and appreciate the opportunity to speak here and look forward to hearing more about the great work that's being done. And also, I just, Lancaster County, we're very appreciative for the work that you all have done, and in partnership with the department. I know our Bureau of Epidemiology has, I don't know when the partnership started exactly, I think it was a few years ago, but we have a data use agreement with Lancaster County in terms of being able to share data around blood lead levels, and the community here has really rallied around making sure that they're identifying those children, that they're reaching out to those children and families, and getting their confirmatory testing, and then providing access to the different mitigation testing resources that families need. So I just want to thank you all again for the opportunity to speak. It's a real great pleasure to be here with you all today, and thank you again for joining us all in our mission at the Department of Health to achieve a healthy Pennsylvania for all. Thank you guys very much.
It works. Can you hear me?
Yeah.
Okay, great. So we do have time for some questions. If you want to raise your hand, I'll come by with the mic if anybody has any questions. And please just say your name and where you're from.
Hi, I'm Ariel from Delaware County Health Department. I'm just curious if there's any talk about getting a new PA med system,
A new PA system.
updating it.
That's a good question.
I get it a lot.
I don't offhand know if there's, at least I should say, I'm not aware that there's any talk of getting a new PA med system. I do know we are working to make sure we have secure funding for the current PA net system that we have.
Anyone else?
Hi, Jeff Martin. Thanks for coming. I'm not sure if you actually will be able to answer this or not, but I'm curious. Lancaster County now is the largest county that does not have a public health department in the county. We do a board of health in the city. But when you review and look over sort of I think it's Act 315 and the requirement for establishing one that was written in the 1950s, is there any thought or work going on at the Department of Health level to update those and kind of bring it into the modern age with EMRs and, large data sets and the things that, modern health systems and things that we already provide in order to kind of make it a little more palatable for counties to engage and try to get a municipal public health department?
Yeah, Dr. Martin, I appreciate the question. I don't know that I have a great answer for you. It is in act, and so I do it's good to make it, to distinguish between what the Department of Health can do, which is usually through regulation, and what is up to our state legislature to do, which is through, they legislate the acts themselves. And so we don't necessarily have the ability of the department to change the way the act is written, and nor are we able to, we are not a political agency, and so we're not able to advocate necessarily for a particular piece of legislation or not. So I would encourage you all, if that is something that you're thinking about, to talk with your state reps and your senators about broadly across the state. I think certainly you recognize or bring up a challenge. We haven't had very many new state, local or community health departments, county rather, health departments that have formed across the state, and I think that's probably for a number of reasons, and one of those is the money it takes to do so, and what the act provides in terms of supporting a local health department may not cover the costs of what the operations, or may not come close to covering the cost of what those operations are. So I don't know that the health department, that us at DOH have any specific plans around the act itself, but if it is of interest to your communities, I would strongly encourage that you talk with your local reps and your senators about that. Certainly, one of the things we are doing at the department is looking to update a lot of our regulations, and so at the department we regulate healthcare facilities, we have communicable disease regulations, and some of these, for example, this isn't a direct answer to your question, but just in terms of what we're doing on the regulatory front, our hospital regulations haven't been updated in I think about 40 years, and as you recognize, when Act 315 was first written and when these hospital regulations were last updated, healthcare looked, and public health looked, I mean, the world today and the world that was imagined 40 years ago are entirely different. And so as we're looking at those, it is imperative to be able to update those to reflect the realities and the current practices in healthcare, to make sure that we are promoting and ensuring the safety of patients across the Commonwealth, but also making sure that there aren't regulatory barriers in place to common sense practices across the healthcare system and public health. And so we are working really hard. The Secretary has taken on as a priority updating those regulations, and they take a long time, as I've learned here. I don't know how every state's regulatory process works, but here in the Commonwealth, it is a multi-year process to update any of the regulations of the department, and it goes through a number of layers of feedback, opportunities for public comment. That's another piece I'll mention. This isn't, again, specific to lead, but just for awareness for folks in the room, when regulations are being updated through the Department of Health or through any other state agency, those get published to the PA Bulletin, and so you can subscribe or follow the PA Bulletin, and there's opportunities for public comment and input on those regulations, and we really value at the department the opportunity to receive feedback from stakeholders and partners in the community. It helps shape, we do our best to write an initial draft of regulations with a great team at the department, but ultimately, we don't necessarily fully account for all of the realities of practice, and so hearing that feedback from stakeholders, from partners, from healthcare systems, from doctors, from patients, really helps shape the regulations, and helps ultimately in the end make them better. And so this is a really long and winding way of saying I don't have a direct answer to your question, but I do encourage, again, if you're interested in having a health department here in your county or in your city, and don't feel like Act 315 provides sufficient resources to do so, or is not only on the resource end of the money, but maybe is too restrictive in its requirements, would strongly encourage you to speak with your state reps or your state senators as well. Thank you very much.
So I'll just put in that, and my folks here from Delaware County, we were the ones that
Yes.
did the last health
Yes, you guys were the most recent.
Yes. So we can write a whole book about that if there's. But, there's somebody in the back. While I'm going to the person in the back, I do have a question. Pittsburgh area is doing a lot around GIS mapping and heat maps that are like more real time, and a lot of municipalities and counties has said that would be a really helpful thing. We have mentioned it to some of the folks in epidemiology, but just wondering what your thoughts are, or if that's something you could pass on.
Yes, I'd be happy. I was going to say, I don't know specifically what the folks in our Bureau of Epidemiology are working on from a GIS and lead perspective, but in general, I think GIS is a great, coming from a public health training background, GIS is a great analytic tool for being able to identify geographic trends and really get down to much smaller levels too. I mean, I know some of the data I was talking about, the general trends geographically were very broad, sort of at the county or broader level. GIS gives you the opportunity to really burrow down into neighborhoods, into census tracts. So I can't speak for what Dr. McHugh's team in the Bureau of Epidemiology are doing specifically, but I'd be happy to pass along the work that they're doing in Pittsburgh and see if it's of interest to folks in the Bureau. Thanks for sharing that.
Question about the WIC program. I'm not sure if you have anything to do with that, but in the healthcare system, we struggle getting lead results from WIC. I hear that they screen some children for lead, but as a primary care office, we don't get those results and we haven't had success of getting it. Is there any way to say when you get a flu vaccine at the pharmacy, they ask who your family doctor is, that those results be faxed? That way, if they are actionable, we can help facilitate additional testing and make sure they get the resources that they need?
That's a great question. So if I'm understanding the question, there's a gap in when WIC is ordering testing and receiving a result for lead testing, it's not getting back to the child's pediatrician with that information to follow up on. I don't know the specific process around that in our WIC offices, but I'll bring that feedback back. What region are you in?
I work for WellSpan, so we have York, Lancaster, Danene,
You cover a wide swath.
yes, and each WIC program, it doesn't matter which county it is, we haven't had great success rate when we outreach and the results.
Got it. And is just for my own curiosity, when you do outreach, are they telling you that they can't share that health information with you for HIPAA-related reasons, or I know sometimes it's just hard to get somebody on the phone to actually ask even?
Just the callback generally.
Okay, got it, yeah. I empathize with that because I know our state health nurses do a lot, our community health nurses and our state health nurses do a lot of public health investigations, which requires calling various provider offices. And when I ask, when we talk with them for their feedback about ways we can make their job easier, one of the pieces they talk about is how much time they spend on the phone calling or on hold, And I was a primary care doctor in my residency training and remember how hard it could be to get a hold of colleagues, or probably how hard it was to get a hold of myself at points in time. And so certainly empathize with that. And I'll bring that feedback back to our WIC program and see if there's anything at the state level that they can do to help coordinate with the communicating the lead levels to pediatricians and primary care doctors. Thank you for sharing that.
Just to expand on that, but just because a little bit has come to us, the Lead-Free Crimes Project, as we work with counties, another piece of that is the point of care testing that's being done, that some WIC offices have done and some private practices have done and different healthcare providers. And I know it's something that the Pennsylvania Department of Health has been trying to make it kind of standard for reporting. I don't know if you have anything.
I don't know if I have anything else on, but I'll certainly bring the feedback back. I do appreciate it. It's helpful to know, and I will communicate that to our team to see what they're able to do in that regard.
Yeah, I think they were just trying to make recommendations for the point of care.
Dr. Tom Vernon, that was a really good overview. Thank you. Concerning the blood testing legislation, SB 850, what's its status? What can I do to help promote it? But more important, what can we collectively do to make sure it is passed?
So offhand, I know the bill has been introduced. I don't know whether it sits in committee. I think it's probably in committee would be my guess, although I haven't checked recently on its status. But generally it's got to, first it's sort of marked up and addressed in committee, and then if it's successfully voted out to committee, then the Senate would have the opportunity to amend and vote on it, and then if they were to approve it, it would move on to the House for approval. So I know the bill has been introduced in this legislative session. This legislative session, as you may all be aware, I think has also been slower than normal because of the state budget impasse. I think most of the legislators are still focused on trying to address that, and so other legislation may not be moving through as quickly because a lot of energy is being devoted to addressing the budget impasse. In terms of what you all can do, again, I think it would probably be similar to what I was talking to Dr. Martin, or answering Dr. Martin's question. I would reach out to your state reps and to your senators. I think, certainly community advocacy and the power of forming a coalition, which you all have here in this room, and mobilizing the power within your coalition, I think is a powerful force as well, and something that lawmakers and folks who work in state government respond to. But ultimately, it's going to be up to the legislature, and they respond to their constituents. And so I think making sure that your voices are heard, sharing your concerns about the current situation, and sharing if you're in favor of the legislation, sharing why you're in favor of that legislation and advocating for it. Again, it's not something we at the department specifically can do, but you all in this room, I think, are well positioned to be able to do that. And certainly we support the value of universal testing, again, to address those gaps in what we see in the current system here in the state.
And not to keep adding on, but we also have a bill coming out. It's supposed to be dropped. It was supposed to be dropped last week, but it's dropped this week. Representative Lads is sponsoring one in the House, and that is a bill that we're working really hard because if those of you who have been with us for a long time have known that we've tried 2 sessions now to get the bill passed in the Senate, and it kind of gets there and to the very end, and then certain groups block it. So we're working with the House right now to see if we can get it through the House, and we feel there's a lot more support right now in the House to get something moving. And that, what we're calling this bill, is 2 tests by 2. Very simple. And hopefully we'll get that bill number out to you next week. And with a bill in that the Senate, then it's a companion bill, and sometimes that's a little easier for us to get something moving. So we'll be sending information out on that. Anybody else have additional questions? You're good? Okay. Anybody else? Wow, you guys are usually really, really talkative and have lots of questions. You must have covered everything. All right, well, if there's no other questions, please give a round of applause. Well, thanks to everybody for participating so far. I hope it's been enjoyable. We had great morning speakers, and we have more to come. So as we begin this part of our program, I have the honor of introducing Mayor Sorace, who is, I've been told, one of the best human beings.
Yes.
Don't believe everything.
She has set forth a vision of building a stronger, more equitable Lancaster, block by block, underscored by 4 strategic priorities: strong neighborhoods, safe places, sustainable economy, and sound government. In her time as mayor, Lancaster launched the Department of Neighborhood Engagement to elevate neighborhoods and empower residents, secured record grants to remediate lead and promote safe streets, and made historic investments in affordable housing. So Dan, thank you.
Well, good morning, everyone. It's a pleasure to be with all of you, and I would be remiss if I didn't acknowledge the staff that are here from the city of Lancaster. Would you please stand so we can recognize and thank you? I really appreciate our team that works on this issue so diligently every day, and their work is very inspiring to me in what I have been able to realize during my 8 years as mayor. So I was first introduced to the significant problem of lead paint in our community by Dr. Martin in 2017. I was on city council, I was running for mayor at that time, and then Mayor Rick Gray invited him to speak to city council about the significant issue of lead poisoning. And I have to tell you, I had no idea. I had simply no idea. He shared that Pennsylvania ranked 4th in the nation for the percentage of housing constructed prior to 1978. Of course, that's the year that lead was banned from paint. And at that time, Dr. Martin reported levels of lead exposure in our community that were greater than Flint, Michigan. And of course, Flint, Michigan was in the news in really big ways, very negative ways for that community. And here we were sitting around a table in Lancaster, Pennsylvania, and our rates of lead exposure were more than twice the percentage in Flint. And during Mayor Gray's administration, the city had been receiving about $1 million from HUD to address lead in homes. You know, funds were pretty limited when you have $1 million to work with. It was about $7,000 to $9,000 per unit, and it did not include window replacement. And we know that windows are a source of friction, which can create that lead dust, which quickly finds its ways into our children's mouths. At that same meeting, because I went back to actually read the meeting minutes from that meeting in March of 2017, was a landlord who was pushing back vociferously about not being responsible for remediating lead, that it was going to cost too much, and that we were on the path, if we moved in this direction, of elevating rates and elevating rents and pushing people out of their housing. And so it was a very interesting counter argument that was happening at this meeting when we were hearing that our rates are higher than Flint, Michigan, and we had a landlord that just happened to be there that night who was also very, very vocally pushing back. So reflecting on Dr. Martin's comments, I remembered a time when I was in my daughter's first grade classroom with Miss Tobin. My daughter went to Fulton Elementary School. It's one of the several elementary schools that are part of the school district of Lancaster. And Miss Tobin asked me to help some kids that were having a hard time differentiating between a quarter, a nickel, and a dime. And so, you know, I'm 5'4". I'm sitting at one of those little desks, you know the kind, where even at 5'4", my knees are up to my chin. And I'm working with this little boy, Xavier, who, you know, they're 7 years old. They're adorable. And we were reviewing a quarter, a dime, and a nickel. And it's a little tricky because a dime is actually more value than a nickel, but it's smaller, right? And so just kept going over the same information for like 3 days in a row, and Xavier could not land on identifying which was the quarter, which was the dime, which was the nickel. And I just got to thinking, like, is this lead poisoning? Like, was that what this was? You know, I'm never going to know. I'm not privy to that information. I'm never going to know about Xavier. But it made me think about, how is he going to learn more complicated concepts? How is he going to grow and thrive as a young person in our school district? And then what does that mean for his future in terms of graduating, getting a job, being independently, supporting himself, his family, etc.? And all of this was hitting me as, you know, as I'm running for mayor, I'm talking to neighbors across the city, I'm walking through our neighborhoods, I'm seeing the conditions of housing, very contrasted in certain neighborhoods compared to others. And I'm recognizing we have limited resources, we have landlords that are not gonna like, you know, us moving in a direction which we're holding them accountable. And also recognizing the irreversibility of lead in our children's brains. Like, we can't get it out, you know, once it's in a child's body. Oh, and you know, Lancaster has no county health department. So we were behind the 8 ball on any child that was tested for lead, had already been exposed. So we were finding out about them maybe a year later, if we were lucky. So I am so proud to say that the city of Lancaster began methodically addressing lead paint poisoning in our children. And that journey began in 2019 when we were sitting in my office, the lead team at that time, and we were discussing whether or not we were going to go for it. And going for it meant that we were going to go for the biggest HUD grant that was possible, and that was going to be $9 million, and we got it. We got it. We went from $1 million of investment to $9 million, and that was just the beginning. Last year we got that same grant a second time, another $8 million to continue to expand the work, and today our incredible Office of Healthy Homes team is 5 years into this work and has remediated 500 housing units in the city of Lancaster. But we didn't stop there. We also made ordinance changes that require all rentals to be certified lead safe. Previously, the ordinance in place only ensured rentals with children living in them were lead safe. Well, we know that that changes really quickly, and that grandparents and aunties and uncles are taking care of their kiddos. So we knew that it was critical that we expand. At first, we definitely received the resistance from the landlords. But over time, many of them became advocates and gave us really thoughtful feedback about how we could do this and do this in a more streamlined way. So in February 2023, the city housing inspectors began testing every rental property for lead paint. And that has allowed us to make sure that we are methodically working through all of our properties that are registered and licensed as rental units. So for context, in 2024, we've completed 5,000 inspections. We have about 14,400 registered rental properties in the city of Lancaster. So that gives you a little bit of idea of what we're doing. We also put in place an agreement with the Pennsylvania Department of Health to share data with us. Remember, we don't have that health department, so that when a child has an elevated blood level, we are notified and can immediately address issues in those homes. And I remember our team talking with me about this, and me looking at the data that was coming from the state. I think that one particular year that we were looking at, again, well after the fact, there were like 60 or 70 kids in the city that had tested positive for an elevated blood level, and we knew about 30 of them. And so our relationship with the Department of Health directly is meaning that every single kid in the city of Lancaster that is testing positive for an elevated blood level is coming to us, and that we are remediating and working to remediate that home. Now, the long-term goal, obviously, is to make sure that those number of kids is going down while our continued investments and rehab of homes continues to go up. And we know that we can't stop this work. We know our housing stock is very, very old. But I am incredibly proud of our commitment to significantly expand the city's response to lead paint. So, like I said, I'm never going to know what happened to Xavier, but I think about him when I think about this work. And every time I see one of our signs in front of a house that says Lead Safe Lancaster, I know that in fact we are realizing our vision of building a stronger, more equitable Lancaster block by block. So I want to thank again our lead team for leading the way on this. You have built relationships. You have established a word of mouth that is spreads like wildfire through our neighborhoods, in which people are coming to us. We are figuring out how to do the paperwork in ways that are, less demanding, and also making sure that we can access the other programs that we have around our critical repairs program, which addresses roofs, HVAC, sewer lines, all the things that can really make a home inhabitable and really cause a tremendous impacts for families. So the most affordable house that any family is in is the one that they are in right now. And so collectively, we are building a whole complement of services in addition to our lead program. I really want to give a special shout out to Elaine Esch. You've been an incredible leader, and you've really built out our Office of Healthy Homes in ways that I quite frankly didn't imagine. And so I really appreciate your work, Elaine. The other significant milestones in this journey has been partnering with Penn Medicine Lancaster General Health. It began with Dr. Martin. It has continued through the investment of $50 million of funds dedicated to removing lead from across the county. And I'm really pleased to invite Lindsey Pringle up, who will moderate the panel. Lindsey is the current manager of community health and wellness at Penn Medicine Lancaster General, who is managing pediatric injury prevention and health initiatives. She serves as the Safe Kids Lancaster County coordinator and co-chair of the Lancaster County Child Death Review, which is an awesome responsibility and not work that I know she takes lightly. At the state level, Lindsey sits on the board of the Pennsylvania Immunization Coalition and as an executive committee member of the Office of Gun Violence Prevention. Lindsey, thank you for having our children and their well-being at the heart of your work, and I invite you to come and moderate our next panel.
Well,
let's get started then. So, first, I would like to introduce Dr. Jeff Martin. So I'll have you come up front and take your seat as well. I'm only introducing names. They're going to do their own introduction because I can't speak to the expertise and wonderfulness of all of these people. Elaine Esch, you just heard from her as well. Another shout out from the mayor. Well done. Very good. Take your seat up here. Elizabeth Hivner. Manager of Community Health and Wellness as well. And Darren Palmer, we'll have you come up and take your seat as well. And they all went in their assigned seats. So organized here. Well done. Very good. I'm going to put this on the table because it's stressing me out. But you won't have this. Is this working too? No. Just turn it on. Power on. Is it on? Yes. Wow, it sounds so different than this one. Okay, great. You all will be using this one. I will use this phone one. Okay. I also feel weird sitting, but that's what we're going to do today. You can hold on to that first. All right, so like I said, first we promised introductions. So we will start with Dr. Jeff Martin next to me. A brief intro, please, and then we'll work our way down the line.
It's great to be here. I'm Jeff Martin. I'm a family doctor. I've lived in this community now for 31 years, and I currently chair the Department of Family and Community Medicine at Penn Medicine Lancaster General Health. I medical direct lead-free families, and I also work in our residency program.
I'm going to try to hold it a little closer to my mouth. Can you hear me better back there?
Yeah, we're turning it up too.
Okay, great. My name's Elaine Lapesh. I am the programs manager for the Office of Healthy Homes with the City of Lancaster. I want to take just a tiny little detour and recognize someone who's here who was very important to my journey in becoming a program manager. Suzanne Long is here, and she is a nurse that 25 years ago I met because my daughter, my 2-year-old, had lead poisoning. And Suzanne was working for the Department of Health at the time, I believe, and she would come out to my house it's gonna make me emotional. She's very much a part of our life at that time. So she would come out every 3 months and test my daughter's blood level in the back of her hand and look through my house with me and try to figure out what the culprit was. And you know, we never really found a smoking gun per se. We found a couple of antique chairs that were in my kitchen that were lead painted. But I know myself that I'd done a lot of home renovations and I probably passed it along to my daughter. So Suzanne went on to start a business, Property Lead Inspections, and they've done so much good work all around our county as well as other counties. And I just want to shout out to Suzanne this morning and thank her.
Good morning, everyone. My name is Elizabeth Hivner, and I am a manager of community health with Penn Medicine Lancaster General Health, and I oversee our lead-free families work. And I am really happy to be here and be representing a mighty team who's back there, which I think we can give an applause to. Can you guys raise your hands? And also wanted to recognize GHHI and Ruth Ann is sitting up front here, and they're a fantastic partner and have been great to work with as well. And the city, of course, we'll talk about all that more later, so thanks.
Good morning, everyone. My name is Darren Palmer. I am the manager of the Green Healthy Homes Initiative, partnered with Penn Medicine LGH Lead-Free Families Program. So I have been working with the program to accomplish all of our benchmarks and goals that were set forth through the $50 million initiative that Penn Medicine's board put up to accomplish 2,800 homes in 10 years.
Okay, so before we get started, Mayor Sorace did give a little bit of a history about her knowledge of the program. What I'd like to do is also give Dr. Martin an opportunity to talk about the history of the program and the financing, and then we'll go into some individual questions with the panelists, so if you wouldn't mind.
All right. So I always roll out the old guy when we want to talk about history. One interesting thing that happened at that pivotal 2017 City Council meeting where we presented on lead was there was another gentleman there who was actually a realtor, not the one that was most vociferous as Mayor Sorace talked about. anyways, at the end of the meeting, we were walking outside, and he came up to me and he said, you know, I really struggle with this because my wife works at IU13, which provides developmental and disability services. And even though I'm a realtor, I really struggle because I know she deals with a lot of kids that may have needs, and some of that may be due to lead poisoning. And so I looked at him and said, okay. And I didn't really say much until he said, well, I guess I'll go have to talk to my wife. And I said, yeah, that would be a good idea. So at least maybe we changed one realtor's mind at that meeting. So the timeline of lead in Lancaster City and County goes all the way back to the 1980s. So that picture on the far left of the slide there is actually a spring that flows out of our Lancaster County Park, which is a great place to go for recreation. And a mentor and colleague of mine, Al Peterson, who's an environmental advocate and still very much involved in immunizations and children's health and all sorts of things, started a very small lead coalition back in the day. So this is over 40 years ago. And one of their initial wins was getting a sign posted in this spring after they got it tested, because we had many people that would come to get the fresh and healthy water out of this spring. A lot of folks in our immigrant community would come there. It was free, it was cold, and people considered it spring water, so they thought it was healthy. Unfortunately, it was tested, and they found that not only did it have a lot of lead, but multiple other toxic heavy metals as well. Apparently, the county park, which is partly built on reclaimed land from a landfill that shut down in the 60s, was still producing some of the toxic waste that was coming out of it. So now there's a sign, I went and visited it last evening, up over the spring that says not fit for human consumption in 3 different languages. So that was kind of one of the initial wins that the original iteration of the Lancaster County Lead Coalition had. In the mid to late 2000s, I had the pleasure of serving as the president of the City Board of Health and got to work with some amazing health officers for the city, and I just have such good words to say about our city and our Board of Health. Part of our job included kind of the mundane things of reviewing restaurant inspections, tattoo shops, and we every 2 months got a list of houses where there was a child that was living with an elevated blood lead level. And because of lack of resources, we often saw that these homes and rental properties sometimes took upwards of 2 years to be remediated, often housing and exposing multiple families to lead hazard over time. So this was obviously distressing to me as someone who believes in primary prevention and the health and welfare of the children that we take care of. My colleague Bill Fife wanted to publish a list of these homes in the newspaper, which I found at the time quite forward, and I sort of wonder now what our PR people in the hospital would think about these doctors going rogue and just publishing a list of homes in the newspaper. We said, look, these things are dangerous for kids. People should know about it. If you know of a hazard in your city or county, you would let people know. So instead of doing that, what we settled on doing was a less confrontational approach, and both Bill and I knew a lawyer, Katie Schultz, who worked for our Mid-Penn Legal Services that provides free and pro bono legal care for people. And she wrote a letter to then Mayor Gray, who also is a lawyer. And of course, lawyer to lawyer communication is always better than doctor to lawyer communication. And it did seem to spur a lot of action at the time. And I was kind of amazed at that. It was like the first time I really thought, wow, we need to have lawyers interact more often with healthcare and public health, because they do amazing, amazing work. So the city strengthened its lead ordinance and the oversight of the lead hazard homes, and received their first HUD grant and started remediation efforts. In 2010, in order to support this new lead ordinance and HUD funding, and along with LGH, Alice was a big part of that, who spoke earlier today, and the Partnership for Public Health, we formed a new iteration of the Lancaster County Lead Coalition. Susan Eckert, who used to run the United Way, was involved, which was good because everything Susan Eckert does is good. We were small but mighty. There was people from Lancaster General, UPMC, the city, Franklin and Marshall, the PA Department of Health, our FQHC in town, which is now called Union Community Care. And with the help of Mike Horst, who was our epidemiologist at the time, we produced something that really helped us gain momentum, and that was a simple GIS map of old housing stock in the county and where the elevated blood levels were. And I can't emphasize enough that having that pictorial, graphic representation of issues affecting kids in Lancaster City and County was probably the single biggest piece to get people to kind of change minds and realize that this was a problem, we had to deal with it. We received grants, we had articles in local media. Franklin and Marshall engaged students to go out and do environmental testing, and they discovered that, lo and behold, it's not just a paint problem, but we have soil problems with lead as well. And we also engaged with the Penn and the Center for Excellence in Environmental Toxicology. So Marilyn Howarth is here, and she was very instrumental in helping us, provide sort of the bigger name, the scientific, the research background in order for us to continue our work. So thank you for that. So over the years, the Lancaster County Lead Coalition has had members come and go, but one unifying aspect is that it is a broad tent, and inviting anyone who is at all interested in seeing a reduction in lead poisoning in our community. In 2017, as the mayor mentioned, Lancaster City took the bold step of increasing or strengthening their lead ordinance and received an even larger HUD grant, as she mentioned, the same size that large cities like Boston, Philadelphia, Houston received. Lead Safe Lancaster was also formed, and Mayor Sorace has been a staunch advocate for reducing lead poisoning in our city. In 2021, the Penn Medicine Lancaster General Board decided they wanted to do something bold for our community. What could they add to add value to taking care of the health and welfare of the folks that we serve, which is our mission statement, and putting the commitment for $50 million over 10 years. And we developed our relationship with GHHI, and Ruth Ann will be speaking at the end of this conference, and that's been very pivotal in our work. So as we head toward the 2030s, we're going strong. The Lead Coalition continues, and several other municipalities in the county are starting to strengthen their lead ordinance as well. So why is this important? Because I was trying to think, what was the special sauce that made this happen here? And I would say that in part, doing good work takes time. And sometimes we don't feel like we have the time. The road forward obviously is not always straight, but I have no doubt that the continued engagement by our community and the work of the Lancaster Lead Coalition spurred investment, interest, but most importantly, collaboration. And I know that's often, too frequently used word, but I really think that that's where we're headed now. And the coalition is in good hands with Dr. Jennifer Brubaker, who I also saw here. This was not somebody leading a movement. This was a group of people coming together to make an insurmountable problem less threatening and more manageable. Thank you.
Alright, you can hang on to that. What are you guys not talking about? No, I'm just kidding. I have a list of questions. Okay, so Dr. Martin, we're gonna give the mic back to you. So I have 2 questions for you, and because I have high functioning anxiety, I'm only gonna do one at a time for you rather than do 2 at a time. It stresses me out. Okay, so what convinced, yeah, you're welcome. What convinced you and Lancaster General to make this huge commitment to the children of Lancaster?
So again, this was something that I was trying to think about. I think that people like to put money and resources behind people that are already engaged and excited about tackling a problem. We also, through our community health needs assessment, realized that housing, healthy homes, housing insecurity, issues related around disparate housing in our county was important, and that coalesced around trying to abate lead hazards in homes. And I think that, again, without sort of that, decades of work prior to that that would not necessarily have been the first thought that people had. So I know that sounds maybe too simple, but I do think that people are interested in supporting good work that's already being done by a collaborative group of people, you know, rather than singular individuals. So.
And the second question, what would you say to other health systems that are considering a similar investment? So in Lancaster, we're lucky. We have a number of health systems in Lancaster County. If you're from another one, where are you? I know I heard Jen Brubaker and I saw you earlier. Where is she? She's still here. I'm going to call her. There she is in the back. Hi. I know we have WellSpan folks here, Stephanie Boyd. Oh, there she is too. So in Lancaster, I know that we are a very collaborative group. And so, so Dr. Martin, what would you say to other groups that are considering something similar?
I mean, we're all focused on health-related social needs at this point. I can't think of a better return on your investment than to put money behind reducing lead poisoning in your community. The downstream effects for health, for social programs, for county programs, or behavioral health and developmental services, the decrease in incarceration, the decrease in crime, the better life expectancy, the better amount that people can work in good paying jobs. I can't think of a singular issue that has as much a return on investment than investing in decreasing lead hazards in your community. And the reason why this is important for health systems is that health systems generally, not everywhere, but generally are long-term members of that community, right? Insurance companies come and go. You change to a different insurance company based on price, but that health system that's anchoring in that community, and I think we're blessed to be able to have that here in Lancaster, you know, is there for the long haul. And to think about it over the long term, to think about, you know, those investment dollars bringing back benefits to the community, it takes a longer term vision to do that. I think health systems are better positioned to do that than other systems in communities. I also think there's a direct benefit to aligning this kind of work with a health system in that we've been able to get lead screening as a health maintenance prompt in our electronic medical record. So it pops up at 1 year, it pops up at 2 years. Nobody has to kind of think about doing questions. They just order the screening test. It aligns the providers around this work. And it's great for me because I'm not treating lead poisoning. The people that are treating lead poisoning are work that everybody does in the community. And so it just reinforces the need for us to rely on our community members to do this good work.
Great, thank you. Elaine Esch, manager, the City of Lancaster Lead Program. Elaine, the City of Lancaster has created an amazing childhood lead program. What are the strengths and challenges of being part of a larger collaborative? If you want to start with strengths, we'll give you a two-parter too.
Okay.
Reduce anxiety today.
Can I start with challenges then?
Absolutely, yes.
I'm going to back up a little bit from the collaboration piece and talk about the biggest challenge for the City of Lancaster was starting out without a health department. So from the get-go, that was our biggest challenge. How do we get this data from the Department of Health? How do we have an organized response to the problem and preventing it? And I think that we tried a couple of different things. But I think one of the biggest steps that was taken, besides the lead ordinance that we've talked about, is we reorganized our bureaus. So we used to be the Bureau of Lead Safety and Community Development. But we had that reorganized after retirement, and Craig Walt, my boss, became the bureau chief of the Health Bureau and merged it with lead safety. So instead of having two different bureaus that are trying to address the problem, we could do it all as kind of an interdisciplinary team. So under his leadership, we have the community health officers who do a lot of the restaurant inspections and tattoo parlors and some food safety and some vector control, but they also address elevated lead levels when they're reported to us. So on the other side, the other team is us at the community, our Office of Healthy Homes, and we have this great grant that we can offer to people to address these lead hazards. So we work together between the two teams, and kind of we're both good cop and bad cop then. so we can actually, confront the issues with housing that may be causing these health hazards for the child. And we can offer this great program that can come in, remediate the home, provide new windows, new doors, all kinds of other benefits, as well as lead hazard prevention. But we can do that from the lens of health in the community. So the biggest challenge turned into this strength that we have. And then in terms of our collaboration, having Penn Medicine and the Lead-Free Family Program, and also the Department of Health funds that we have for lead hazard control has allowed us a little more flexibility. So if there are people that we couldn't serve under the HUD program that don't quite meet 80% AMI or below, the Department of Health has allowed us a little bit of flexibility there. Or if we have people outside of our target areas, outside of the city, we can very easily call Lead-Free Families and they can help them out, take care of them. So we're back and forth a lot between the two teams. We meet regularly as a leadership team and also with EBLO referrals. And I think we've developed a really good system with that.
That's great, yeah. We all have the same end goal.
Yes, for sure.
It's great to work collaboratively.
And I have to say too, we have a really strong team in our office, and they're all at the back table. I won't embarrass them by making them stand up.
I will. We're on there.
All right, stand up, y'all.
Those are hands. I see a bunch of hands. Stand up. Let's see your faces. I have to stand up. All right, fine. Very good.
But yeah, we all have our roles with the team, and they just mesh so well together. There are just ways. I mean, Nat is our outreach and education specialist, and she'll be talking on a breakout session this afternoon about outreach. But she's so committed to language justice and helping refugee families and people speaking other languages. And then, she's back and forth with the rest of us in the office about this or that. Forrest is an expert with housing issues and all kinds of things that we don't know that he knows about, but he does. And so there's a lot of back and forth, a lot of coordination between the members. But then also, again, there's relationships with Penn Medicine. Nat's often on the phone with Mandy and figuring things out. So it ends up working out.
Great. Thank you. Next we have Elizabeth Hibner, who manager of community health and wellness at Penn Medicine Lancaster General Health. So Elizabeth, what can you share what systems are in place to support this ongoing and important collaboration? And then I have a two-parter for you as well. So start with one.
So I think to start, we've recognized that as Penn Medicine, LGH, and the City of Lancaster, we're both doing really important work, and it's only better if we can connect, collaborate, communicate, and work together. I think there's this understanding that we have a shared goal. We don't want to compete, we're really just trying to help the community in all the ways we can. So I think kind of coming together with that understanding has really helped us in the day-to-day and in the details to be able to work effectively together, especially over the last year. I think we've connected even more. Regarding systems in place, Elaine kind of mentioned this, our leadership team meets once a month to talk about sort of higher level issues, concerns, things that we're thinking about as management, things that they're thinking about, and just to come together and collaborate and bounce ideas and challenges off of each other. I think something else that we've done is, or something that has been happening as well, is our team has been meeting weekly with each other to share referrals, to be able to sort of streamline the referral process, to make sure that we are really just best serving the community. There's not sort of an overlap and they're hearing from both of us. We really try to streamline that. And so one of the things that we've done is if there are so non-EBLLs in the city will go through the city as a priority, and then we'll talk about ones that overlap and sort of figure out, is this a Penn Medicine patient? If so, we can take it. If not, then the city can take it, and if there's more capacity on one team than the other, then we'll work together to say, hey, we have capacity, we could take these referrals if that works for you. And so we really, it's in the weeds collaboration, which I think has really allowed us to just really best serve the community and see what are the needs in the community and how can we really be thoughtful in how we're reaching everybody. I think the other thing that we recognize is that there are differences in our programs. So there's different strengths. We're a healthcare system, So we are obviously able to kind of work with providers to be able to increase screening, to have them refer patients. And so that's a huge strength of our program. Also, because our funding is coming from an internal source, we don't have HUD guidelines, that's allowed us to do things like increase the income eligibility. So we're able to serve sort of more community members based on that. And the city has the strength with the lead ordinance that they've spoken about, so they can do the enforcement. And they can also identify other needs of community members. So if they go into a home and notice that lead is an issue, but also they may be eligible for their critical repair programs, they can kind of put them into that program as well. So there's different strengths from both, and we are both sort of aware of that to be able to leverage what is best for the community.
Great, thank you. And then just the second part of the question then is, what advice would you give to others who would like to create a similar collaborative in their own communities?
Yeah, I mean, I think the first step is really recognizing what are the differences and similarities between programs, and where does it make sense to collaborate, to connect, how can you sort of better work together with that? I think that's really the biggest piece. And I think regular communication as well. So setting up a system, like we have these monthly meetings, whatever that looks like, to be able to connect regularly and share ideas and learn from each other is probably the other piece of advice that I'd give.
Great, thank you very much. We'll move on to Darren, Housing Intervention Manager of the Green and Healthy Homes Lancaster. Darren, we've heard so much about your work with engaging landlords, and also know that you have done incredible work with contractors. So what suggestions do you have that would help others doing similar work?
Well, thank you for that question.
You're welcome.
I've had the honor of working with both the Cities Life program and with Green and Healthy Homes Initiative, partnering with the hospitals program, which I thought was a very unique opportunity to work in the county, because for so long the county didn't have coverage for lead poisoned children and with remediation dollars. But I was thinking about this, and really it's about building relationships with people. And I know it's been said that Lancaster City County is a very collaborative county. And so as I was thinking about this, I was thinking, okay, well, roughly about 2016, as we were brainstorming about building contractor capacity and getting landlords on board with our first HUD grant that we had at the city, I was thinking, well, I think what we need is to bring some training in here. And so one of my, something I was very proud of at the city was helping the city become an accredited training provider for the EPA RRP class. And so through that vision, I felt like, okay, we can invite landlords, we can invite property managers, and also, obviously, contractors that are currently renovation contractors, and introduce them to lead. We knew, and I was hoping, that there was a long forecast for, the lead work that we were doing. And yeah, we started training landlords and property managers and contractors, and we would always have opportunities to have conversations with those folks and say, hey, there's money available. Every meeting that I ever attended across the nation, really, the biggest challenge was we don't have enough lead contractors to do this work. How can we overcome this hurdle? And for me, it was really about bringing training into our own community. Contractors, we wanted to build local capacity. There were a lot of renovation contractors, but it's just a little extra. We always used to say, doing lead-safe work practices is just good business practices. When you go into somebody's home, you want to take care of their personal belongings, right? So, yeah, it was really getting in front of those people at those classes. We held a lot of town hall informationals for landlords. We got in touch with the landlord associations. We went to breakfasts with them, and we really just said, hey, we were meeting them where they were, because we understand their challenges as well. And yeah, we just, again, build those relationships and that trust so that we can accomplish what we set out to do. I remember in 2020, we had approximately, with the hospital investment, we had approximately $90 million in the Commonwealth of PA. And we were like, how are we going? And I remember sitting in the mayor's office and she's like, we want to go for this high impact grant. Let's go big or go home. I was like, all right, let's go. And so, fortunate enough to come out with that $9.7 million grant. With the help of the Green and Healthy Homes Initiative, also kicked off our marketing campaign, the first year of our High Impact Award. And it was so neat because Baltimore was also a recipient of the High Impact Grant, so we were like trading notes on how we're going to accomplish this. But yeah, I think that just really meeting landlords where they were and explaining to them the benefits. And once we had a landlord that went through our program, we used them as a messenger really to speak to other landlords. So that was very important because landlords were more likely to listen to, a colleague of theirs as opposed to, municipal government or a hospital program. So yeah, just building trust and continuing to build those relationships. And with contractors, it's just really figuring out what are their hurdles in front of them. Like, what can we do to lower the barriers that you're feeling about taking on lead work? Yes, there's liability, but also if we do lead safe work practices, in a manner where we're protecting the family, and yeah, it's a win-win for everyone. So really, I feel like the landlord and the contractor relationships really went hand in hand. And yeah, so we just continued to build on that, and that's pretty much, here we are.
Here we are.
I do want to give a shout out to the GHHI staff in Lancaster, if they could stand up, please.
Yeah, excellent.
Thank you.
Thank you. I appreciate that. I have questions. Well done. You're allowed to leave today. And so, I have a couple of cards here. The first is directed to you, Dr. Martin. A couple of things. Are family medicine doctors firmly supportive of lead testing? If so, how do you maintain education and quality in this area throughout the health system?
So in Lancaster County, the vast majority of children are seen by family medicine as opposed to pediatrics. Pediatrics, obviously, very important and have, probably a more keen, maybe, understanding of the necessity of lead screening. Family doctors, just like doctors in general, want to do the right thing. And so what we tried to do is make the EMR usable, accessible, so that they can do the right thing. Okay, so if a child comes in at a 15-month well child check and they haven't had a lead test done, it populates under the health maintenance tab just like any immunization, and you click on it once and testing is done. And also reminder to have a brief discussion with the family to say if the child has an elevated blood lead level, or even if they don't, lead-free families might reach out to them. Is that okay? So you get a consent and everything, really just with the click of the mouse. So yeah, I'd say yes, people are engaged and interested as long as it's easy to do those things with competing demands of well child care.
To go along with that, with the screening processes that are in place, what kind of impact have you seen with children?
We have seen a dramatic increase in our screening rates. As far as impacts with children, we've seen better rates related to lead screening. One of the, lead poisoning is a long-term issue. One of the things that I'm really interested in trying to look at over time, and this is why we're going to be applying, to the Department of Health in order to get lead testing data, from 2012 forward, is to kind of see if we can relate that to, are there differences in the number of children in our system that are being diagnosed with behavioral health issues? Does the BHDS system in the county have lower incidence of kids that are in IU13 related programs that deal with special education? And then eventually, thinking long term, I'll probably be very retired by this, but has these programs decreased the rate of juvenile delinquency, adult incarceration? Again, these are extremely long-term outcomes, and I think people need to stay engaged in the long term to be able to look at it. But to me, and I'm sure the health system would like, even though this is the right thing to do, would like to see what is that return on investment, and are we seeing changes in children, in middle schoolers, in high schoolers, and adults going forward. So that's the plan. I don't know if we'll be able to get there, but that's what we'd like to do.
Last night went to the welcome event, and Alex, I think is from Erie. Where is she? Call her out too. Everybody's. We were talking about incarceration, and with lead testing, they were looking at their child death review data to see if those children have had lead poisoning in the past. So Dr. Brubaker sits on the child death review with me. We might have a little bit of work to do in Lancaster County. So this, I believe, is directed towards everybody. That are the community organizations supportive of lead testing legislation? What else could be helpful to make this process stronger?
So I can say we sit as a part of the Lead Free Promise Project on their coalition and are supportive of it and do what we can to provide education. Really, as a health system, that's what our role is to make sure that there's education around lead in general, and a key part of our program is that educational piece. And I think education and awareness is where it starts. I think there's still so many people that don't know that lead is even an issue, right? So if we don't know lead is an issue, legislation is going to be, that doesn't be harder to pass. So our role has really been focused in education and educating community organizations. I guess the question asked about community orgs. So our role has really been to actively be engaging with the social service hubs throughout Lancaster County and providing education not only about the services that we provide through Lead Free, but also about lead and the dangers of lead and how prevalent it is in the community. We are regularly, there was a map that was up here earlier that shows Lancaster County, and I'll be talking about in my presentation a little bit later, but sort of just shows the rates of the old housing stock and the EVLLs in the county. And we are regularly educating people about that. And I think that awareness piece is really big. So, yeah.
Oh, wow. Busy.
Okay.
How much time
I
we got?
talk fast.
Can we hold the mics closer to ourselves? Some people are having to speak. Thank you.
So I know we have different programming up here. So what this is in reference to are different income limits. So is there an income limit to qualify for lead remediation? Are there recommendations for people that do not qualify?
I'll go quick. So for our program, we have larger guidelines. They're more comprehensive, I guess. So for example, it's a 400% of the poverty level. So for a family of four, if you make under $128,000 a year, you can qualify. So those are income guidelines, which is, again, like that's a lot more open than a lot of HUD programs.
Yeah, for our HUD programs, they're all 80% AMI or less. So for a family of four, I think that's $83,000 this year. So much lower than Penn Medicine's program, which is why we are very grateful for them and can refer our folks that don't qualify to them. If they don't qualify there, I have talked to a good amount of homeowners that don't qualify for a program and are just wondering what they can do about lead. And my biggest recommendation is to use a qualified contractor to do the lead remediation work. First of all, you can pay for a risk assessment. I think they're running around $1,000 to $1,200 right now. So it's a bit of an investment in your house, but in the same way you get an energy audit, why not get a lead hazard risk assessment so you know where the problem areas are? Generally, they're not everywhere. But then to use only contractors that are licensed and qualified to do the work is super important.
How do you connect with supportive services such as early intervention and WIC?
So one of the things that we did was to make early intervention an automatic referral for any child that had elevated blood lead levels. And what I'd like to see eventually on the state side is that early intervention would use elevated blood lead levels as a criteria for continuing services. Because one of the things that we do know is kids that do get services early, even if they're lead poisoned, can affect some of the downstream effects later on. So some states have that. I believe Illinois, some other states have that, but I think it's a matter right now of having enough capacity for early intervention in order to do that, but it seems to make sense to me.
Collaboration is a recurring theme. What has been a key to maintaining trust and momentum with community members, clinicians, landlords, etc.?
Communication. So no surprise there, right? But yeah, the success of our program is really built on, like Darren said, networking with landlords and with contractors and continuing the communication between us. I think with contractors, there were different expectations that they had for doing lead remediation work. So back in the early days, we weren't getting the same quality that we are now. So there's been a constant push there, and that has built trust. Because nobody wants sloppy work done on their house, even if it's for free, believe me. So that's been a big thing. And also, as we've talked about, between our programs, just to have scheduled communication, even if we don't have anything to discuss at our monthly meetings, we're touching base and saying hello and seeing if there's anything that needs to be talked about.
Yeah, I was just going to add to that. I think the quality improvement is a really important piece of what we do. I think that's an important aspect of trust because people are trusting us to go into their homes and not only do a good job in remediating the lead, but also being the least disruptive and also doing high quality work. So GHHI has been fantastic at facilitating really a lot of that, and I think the data collection piece of that is also important for us. We collect a satisfaction survey, and so we're able to sort of monitor what's working, what's not working, and how can we continue to make improvements.
With the GHHI model, we're actually grading our contractors. They get a rating system. All the surveys that are sent out 2 weeks post final clearance, we're collecting all that. We share that with our contractors. We hold annual contractor meetings individually, so we can really focus on their performance and look at where they can improve, look at where we may be able to improve, and we keep track of all that. We include that in their performance review. So,
what is one barrier that you did not anticipate when the initiative started? That is for all of you.
I think that one thing that constantly surprises us, speaking for the team, is when people are unwilling to relocate in order for us to do our work, or when they come back and their expectations are different than what we have carefully walked them through. Things like not putting back up window coverings if we're replacing windows. So we tell them from the get-go, if we're putting in new windows, you will be responsible to install your own window coverings. But small things like that has it is a barrier and it's difficult to get past. We also have had some struggles with relocation just with very large families, sometimes with a large number of children and only one adult. So that can be a barrier and would not have been something we would have anticipated.
Yeah, I think from our perspective, we are primarily in this work because we want to reduce EBLLs in Lancaster. We want to prevent lead poisoning. We're a health system. We care about the health and well-being of people. And so when we're presenting information to families and or if we get a referral and they're not interested in engaging and there's an EBLL, that is surprising. And I think, at some point we get used to it, but I think still surprising because we know that there's lead poisoning taking place and there's not interest in action. So, and that's where the awareness and education and all of that is so important.
I think a barrier was for contractors really to, especially local contractors, your smaller mom and pop contractors that live in your community, where we feel like they actually take more investment in their work, living in the community because people know them. And I feel like the cost of starting up an abatement company is daunting and expensive. And so in trying to recruit contractors and letting them know that we have a steady stream of work coming, it's guaranteed payment in a timely manner, are all things that we've helped overcome some of those barriers, but yeah.
I'm gonna have you hold on to that, Karen. Just
Can I add something?
Yes.
real quick?
Okay.
Assuming a lot of you are HUD recipients, I do want to throw in the cost factor and build on what Darren was saying. As you know, the high cost limit used to be $25,000 for HUD, and then $35,000, and now it's $75,000. And HUD, during one of our audits, really encouraged us to do more abatement and get rid of stuff instead of just doing interim control. So we've started doing more abatement, but that's driven our prices up, and then we hit the prevailing wage factor. So anything over $25,000 has to be prevailing wage in Pennsylvania. And so that was a barrier for us because we thought it would be so daunting for us and for our contractors. And it turns out it's not that big of a deal. So if anybody wants to talk to me about that, like during lunch or this afternoon, please let me know. But our contractors were surprisingly receptive, and a lot of them had already prided themselves in paying well for their licensed, certified, trained workforce. And so the prices weren't that far off what they were already paying. So.
I just wanted to add one more thing about training up contractors. I think we've done a great job collaboratively with Penn Medicine and the City of Lancaster and GHHI in providing training opportunities free training opportunities, I might add, for lead worker classes, lead supervisor classes. So that also is something that you need to look into. Somebody mentioned that HUD funds and even the ARPA funds from DOH were including training allowances. So look into those. Bring a training provider to your site. I know Panoni was here last night. I haven't seen Steven today, but yeah, just having those opportunities to train up not just new contractors, but also build capacity with current abatement contractors to build their workforce.
I have a question on contractors. What steps are being taken to recruit qualified lead contractors? Three factors in construction remediation: cost, quality, or time. Pick the two most important! And why?
Well, quality contractors is extremely important, right? I think demonstrating that you can go in and protect the family's home while you're doing the work, really having good carpentry skills. Like, we've trained thousands of people across the Commonwealth in lead abatement and lead safe work practices, but I don't think we've done a good job training the skill set of carpentry, of replacing windows, hanging a plumb level and square door. So I think we need to focus more training on that. But there are some challenges with that because the insurance fees alone, and with the liability, the workman's compensation, and the general liability and errors and omissions policy. So there's a lot of fees there. It's really hard to say. When new contractors come to us, I like to see some performance ahead of time. Please give us references and some jobs that you have done. We currently are operating with 7 abatement companies, and we feel like we're at a good place with that. So, we've had more, but again, the quality needs to be there. So we've kind of weaved through that, and yeah, so maybe I didn't answer the question because it's kind of a hard question to say what are the 2 top things. I mean, you need to be able to hang a door and replace a window, but also painting sometimes tends to be the #1 complaint. Over painting from a casing onto a wall or paint drips on the floor. So really good painting skills as well. So that's if Elaine wants to share more.
Also, because you are a lot of you are HUD recipients, we went through an RFQ process this spring, to get more contractors or to develop a fairly procured list of contractors. And that was an interesting process, but that's all through Penn bid. I know some of you have done that. I believe Allentown and Reading went through that process as well. So we developed a list of 8 contractors that we're currently using, but then we still bid out every project. And I would say, so we're operating with 8, Darren said they have 7, and that's a pretty good number for us. We actually have a lot of intense competition right now because we have a little lull between grants. So our contractors are very eager to get more contracts under their belt, and I believe are giving us fair prices. But the timing issue is perhaps more important than the cost issue. If you're saying quality, cost, and timing, which are the most important, we really don't want something lingering out there for months while people clear their schedule. So we have 90-day contracts for most of our projects. We do 120 days if it's in a historic area and they need all wood windows, because those windows are taking about 2 months to come in, sometimes longer. But timing is a very important consideration.
A couple of questions specifically about the effects on people. And so to what extent are pregnant women considered in the efforts to address and end lead poisoning and lead exposure?
So pregnancy is a really important time. The fetus is growing at a tremendous rate. Lead easily crosses the placenta, and so the damage to neurons for a growing fetus is multiple times fold higher than once that child's actually out of the uterus. And so the question has been, why don't we test pregnant women? And the American Academy of Pediatrics just came out with a statement saying that, you know what, that should be a test that all pregnant women get. And not many people are doing it in this country. So we've started conversations, at least in our hospital, to try to make the case for it. And we've done this in the past. The obstetricians have come back to us and said, well, what do I do about it? And well, there's a lot that you can do, right? You can reduce the hazard. Unfortunately, a pregnant woman who's lead poisoned as a child will end up mobilizing a lot of that lead when calcium comes out of the bones to support the growing fetus. And so there's more lead circulating in the mother's body at that time, and so that's why it's a particularly dangerous time. But there's also, you know, be great to know if that child has a lead burden at birth, you know, rather than waiting until they're 12 months of age, because you know, it's harm reduction, it's trying to limit you know, further exposure to that child and the other children in the household. So yeah, I'm a big believer that I think we should be testing all pregnant women just as part of the routine prenatal panel that we do.
Along the same lines, does the age or the size of child matter when it comes to exposure and testing? So for context, they write, someone years ago stated children are more affected by lead because they are smaller, more compact, more concentrated in their bodies.
Yeah, so the size of the brain compared to the body is huge, and so there's more blood flow going to the brain, and so there is that potential to just have more problematic exposure. The blood-brain barrier is not developed early on, which also leads to lead easily crossing through into the brain. So yeah, there are a lot of factors that uniquely put a child at risk for lead poisoning as opposed to like an older child or an adult. Although, as we're finding out more and more, it's still a problem in adulthood. There's a lot of issues related to heart disease, kidney disease, behavioral health issues, risk of dementia later on in life. I mean, they can't hardly even keep up with all the studies that talk about it in adulthood. So, yeah, it's a real problem at all ages, but there are some unique things associated with children that make it really bad in young kids.
So what is a piece of advice or words of support you would give to a parent who has a young child that just received a high lead level, such as more than 10?
Yeah, it's not a diagnosis that people want to hear. And again, I think it's important for parents to realize that this is not like a determinant factor necessarily of what your child may be like. And so I talk about preconceived notions around, what do you know about lead poisoning? What does this mean to you? How can I help you kind of understand this more? And so I try to meet the family wherever they're at in that journey, because some people may have, know somebody or have somebody in their family with lead poisoning. I talk about, thankfully, that we have this great program that is going to reduce further exposure and risk, and that will follow the lead level over time. A lot of parents and, frankly, providers get concerned because even after abatement is done in the house, the lead level in the child doesn't drop really fast, and that's just how it is. We used to chelate kids to give them a medication to reduce lead levels, but we discovered that although it dropped it really fast, even if you gave a kid 2 or 3 different treatments over several months, the ultimate lead level at 2 years of age, 2 years after the elevated, was the same as if you did nothing around chelation. So that's kind of how we got to the point where, we're not getting Suxamer or other medications to chelate lead. I still, on occasion, have parents that come in, their child, say, is a level of 10, maybe 15, and say, I want to get this medicine. Well, 1, it's really hard to get. You can't find it. 2, it's not going to make much of a difference. It won't make any difference, at least according to the studies, over time. Now, kids that have a 45 or higher that are hospitalized, yes, we do chelate them. So, yeah, often it's just having a discussion with the family about what their questions and needs are.
Just from my own experience and what I was told when my daughter had lead poisoning was just to be patient, to be careful and be patient. So there's nothing you can do to go back and change things, but I need to make sure my house was clean. I needed to make sure her hands were clean. She's a big dirt player, so making sure that her hands and feet were clean. And then I believe we did an iron supplement for a while, pumped up the broccoli and the other leafy greens. But also the best advice was be patient, make sure there's no more exposure.
I kind of want to give a shout out to the lead-free family health education, home visits. Dr. Martin was alluding to, we have a program when we have an EBLL and pass it off to the lead-free families program. But with the efforts of the education, the health education in the house at the time when Mandy goes out to do her health assessment and overview with the customers, she is taking tape with her and she is taping up all the chipping and peeling paint in the house, which is awesome. So she's walking through that, trying to eliminate that exposure right away, which I think that's really unique and very great. Appreciate that. But it's kind of funny when our contractors come full circle after the windows have come in, we've scheduled the project, and our contractors are going in, and there's all this blue tape everywhere. It's like, it's kind of funny when, you know, when we see that, but no, we appreciate that to stop that immediate danger.
Mandy, the tape queen. Where's she? Well done. The tape queen. Well done. Very thorough. Tape and simple brain. Love it. Continuing on, just talking about the effects of children. So after a child tests positive for lead exposure, what steps have you taken to make sure referrals to early intervention, including for infants and toddlers, are happening? Looking for tips to share.
So again, an early intervention referral is attached to the elevated blood level when it comes back as a result. So, you know, doctors get results for all sorts of tests all the time, but in this instance, when the test comes back and it's elevated, there's a click on a button that goes to early intervention. So, which is great. And even if that child at that time doesn't qualify for services, because you have to have a reduction in speech development, motor skills by like 20-30% in order to get ongoing services, the folks do put them on a watch list. Early intervention reaches out to that family at regular intervals to find out how things are going and if there's any need to reassess the child. I would have preferred to have them do ongoing therapies in the home with these families, but again, that's a state level issue that needs to be decided.
And then I think we just have one more related to health care before we get into some programmatic questions. But in an effort to catch children who may have fallen through the cracks, is Lancaster County testing school-aged children recommended for IEPs for possible lead poisoning?
No, but that's a great idea. Two of our providers that I work with are actually signing all the IEPs for Lancaster County, so thank you for in planning that. Yeah.
We'll save that one.
Yeah, right.
Perfect. Good. There you go. Great. Okay, so a lot of good programmatic questions here. This one I'll start with. So is there a problem relocating families when the home is being abated or remediated? And who pays for the cost of this relocation?
Well, thank goodness we have money to pay for that too. That is very helpful. We arrange everything for our office. We did an RFP for hotels as well. We have 2 hotels right now that we work with, and they've been really good about making space for us. It's not always easy. I don't know if Nat's going to talk about that this afternoon during her session, but she works really closely with the families to let them know what to expect. She has had situations where families have never stayed in a hotel before. And she's very, very careful with instructions and trying to let them know what to expect. It's not, I wouldn't say it's easy by a long shot, but she's made it work for almost everybody. There are situations where people stay with friends or family instead of relocating to a hotel, especially if they have special dietary needs that they're not able to eat out. We do provide a food stipend to them as well. Which is also HUD funded, so that's helpful for folks. But like I said, if they have special dietary concerns, it can be tough.
I think my answer is about the same exact as yours. Yeah, so our program also pays for relocation. It's so important to be able to have the family not be in the home when the remediation is taking place because of the dust that could come up while the work is being done, and so for their safety, really they need to be relocated, and so we are able to pay for that through our program. And they are only allowed back in once there's a clearance that says that it's safe. So.
Since beginning your initiative in Lancaster, have any of your organizations partnered with health professionals to provide free mobile testing of at-risk children? If so, how did you begin that collaboration?
So no, we have not done that, but it's definitely something that we've talked about. There are challenges with it, with the point of care machine. And so it's something that we definitely have on sort of our bucket list to explore more and see what else we could do to do more screening. We would love to have like a mobile van where we could take it around and take it into high need areas, but there's some like logistical challenges with that. But I'm hoping in the next year or two we can work through those and find a way that we could do pop-up clinics at locations, at one of our many outpatient locations. So it's definitely something we're thinking about.
And speaking a little bit about health education, so what cultural challenges do you face in educating lead dangers?
So I can start off by saying that we have translated our health education materials into, I think, 17 languages. Is that right? 13 languages. And shout out to our table back there if you want to kind of take a look at some of them. We have a lot of our health ed materials out there. So from a language translation standpoint, that's been something that we've been able to do. I think from a cultural standpoint, we do everything we can to meet families where they're at and understand their situation. Oftentimes, Lancaster actually has a really large refugee population, and so there's a lot of folks coming from a lot of different backgrounds, and oftentimes they are lead poisoned from where they came from. There could have been usually comes from a water source, or if there's spices that they bring with them, or pottery from those other countries. So a lot of times those are things that are lead poisoning them, so we are aware of that when we're working with them, just so we can really kind of identify the source there.
Similarly, we know that lead doesn't discriminate and impacts all homes, and also Black and brown children are 2 to 4 times more likely to be impacted. How do we ensure racial equity or economic equity remains at the center of our lead work?
Thank you for this question. I am really passionate about this one thing that, and I know I said this last night, so bear with me if you were there last night, but I don't feel like it's always lead paint that is the problem. It's deteriorated housing. And I strongly feel like there is the racial injustice because of the poor housing that has been utilized as rentals. And I think if we pinpoint and really, well, we have the lead ordinance now, so we are following this. But if we can make sure that our housing is equitable, then I think that we'll see a lot less lead poisoning across all barriers.
Just to add to what you were saying, I think having a really strong property maintenance code in your municipality to keep the housing stock, repaired. I think the ordinances are important. I did have a list of them here. They not only the city of Lancaster, Norristown, Columbia Borough, and Manheim Borough, and of course Philadelphia. I think those things help with the housing stock and making sure that the quality of life. I know when they go into the rental inspections, they are looking at everything, not just the lead. So I think that's really important, collaborating with your codes department.
I think we're probably down to about 2 minutes, so I think this is a good one to end on if each of you just want to do a brief answer for this. But if you had a magic wand, how would you like to expand these programs? And that's it, so thank you. Think big, in your dreams. Magic wand.
I think some of the magic wand is the Healthy Home Supplemental Funding and the critical repair program at the city. So partnering with other communities that provide other resources. So when we walk into the house and do a holistic inspection, we're looking at all health concerns across the board, asthma triggers as well, of course, radon. So just finding as many resources as possible, adding more resources, I think that's the magic wand, yeah.
So we're primarily focused in Lancaster County for our work. I think it would be great if we could expand to other counties and be able to get into Lebanon County, Chester County, York, and really be able to expand the work that we've done. We have a fantastic program, fantastic team. Our model is really efficient and effective. It's like a factory, just like one thing after the other of how we sort of move people through our program. And I think it's a model that I would love to see replicated in other communities and having other health systems across the nation. I think that's sort of my pipe dream, having other health systems in the nation see the benefit of doing the work that we're doing, and be willing to commit a financial commitment to be making an impact in the community like Penn Medicine did.
I would say for the HUD grants, not to be competitive. Not one community gets it over another county, but that every county would have it available, or every city would have it available. And I think HUD has kicked this idea around. I'm not sure where they landed on it because things got a little derailed lately. But I think that's something they're looking at, just looking at the housing stock and how many homes that you have that are pre-1978, and if you want the money that you could get it. I think that would be my dream.
I would use my magic wand, I think, to decrease poverty and increase health equity everywhere. Lead is not the only issue that affects poor communities, black and brown communities. It's disparate, across many different spectrums, but I think thinking about poverty and thinking about health equity in general would be a great way to do this. Lead incorporates a lot of those and can help, but there's so many roots to lead. We have disproportionate lead poisoning in our country. So I would like a wand that would deal with the roots of that, if possible. So.
Thank you all for your expertise and your insight today and for your great questions. We didn't get to just a couple of those, so I apologize for that, but our friends will be up here if you want to ask them these questions. But again, thank you all for being here. Another round of applause.
So right now, I'm going to introduce another star. Ernie Ristro is a devoted community advocate with nearly 20 years of leadership in Philadelphia Logan neighborhood. She's renowned for her commitment and impact. She works closely with local organizations, government agencies, residents to strengthen her community. Ernie focuses on expanding access to social services, reducing poverty, combating environmental issues, and supporting individuals in family crisis. She also promotes youth engagement, advocates for people with disabilities, and helps prevent evictions through educational and legal support. Through her efforts, Ernie strives to uplift her community and enhance the quality of life for all its members. And I can tell you, Ernie rocks. She's been with Children First for a while as a volunteer and really has just inspired you. So Ernie, you want to come up and tell your story?
Wow. Hello, everyone. How's everyone doing?
Great.
Having a good time so far, getting all this valuable information to take back to your communities. So I'm going to pretty much start off and introduce myself. First, I would like to thank Children's First. My team is here. Where's Children First? Under the direction of the fabulous Donna Cooper is not here. And we're surprised. I also have two of my church family members that's here. Reverend Smith and Deacon Smith. Deacon Smith, you're not shy. That was a wonderful surprise. So I'm going to jump right into the purpose of why I'm here. So again, as was mentioned, I wear many hats, and right now I'm putting on my mama and grandma hat, because that's why I'm here today. I have 4 children and 3 grandchildren. And back in June, I received a email from Children's First, saying, hey, if any one of you all are available, would you like to go to Harrisburg and team up? with, Lead-Free Promise Project. And I'm like, let me check my calendar. Of course, I'm available, and if I'm available, I'm there. So we get to Harrisburg, still not knowing all what's going on, and still walking into, just knowing I'm gonna learn something, because that's the type of person I am. I really love to go where I know I'm gonna be educated. And when you continue to educate yourself, you're able to bring back valuable information. And I live in Philadelphia, so I'm part of Philadelphia County. So when we got there, we knew that we was going to get some valuable information from the Lead-Free Promise Project, which is an awesome organization. And when the testimonial came and we had to go speak to different ones there, and the whole concept was, to get legislation passed for the children to be tested twice by 2. And you would think that is something that is simple, but it's not. So my twin babies, grandbabies that I have on my shirt here, you see Zion and Zamir. They are 1 year old on this picture, but they are now 6. When they were born, they was born during March the 19th, and when they was turning a year old, COVID hit. So that was our first challenge. The same weekend that we were celebrating their birthday in March, the whole country shut down by that Monday. That was our first challenge. The second challenge, we noticed these 2 little vibrant little fellas that were pointing to their head, knees, shoulders, and toes by the time they was 2. And then by the time they was reaching the age of 3, going on 4, we noticed some changes, some very valuable changes, some changes that if you're not prepared mentally, it will take you over the edge. And they were both diagnosed on the spectrum. My Zamir is still nonverbal. And as you can see, they both have their fingers in their mouth, so they're twins indeed. So as the years progress with more challenges, being on the spectrum and one is nonverbal still, that was a challenge in itself. And I support my daughter. If there is another symbol of 100%, I'll stick it up to 1,000%. Because not only is she the mom of these twin boys, but dealing with the system and what you all have to do to fight that level in the city of Philadelphia. It may happen in your county, but in the city of Philadelphia County, it's a beast. But my mom is here for it, because that's what I do. So we moving forward, back to the day of the advocacy. In Harrisburg, we heard so many wonderful testimonies, and then how lead can affect, and how lead can lead to possibility of your child being diagnosed on the spectrum, autism spectrum. So many spectrums out there and so many layers. And then what stuck out to me, and it was one of those light bulbs that went off, and it really went off, is when they said it was irreversible. Not only was that devastating, but it put me into another mode. It put me into this, oh my gosh, is this one of the reasons? You start thinking, because you're judged on every level, and my daughter, in her mindset, she's already overwhelmed. She's already going, what's going on, judged and everything else. And what our beliefs, we believe, that God is able and He will do all things for us. That's our belief. But you still have to deal with society. Society will continue to, put you in that rim, put you in that bubble. And once, I don't even think I left Harrisburg without getting on the phone. And we went there that Tuesday. By that Wednesday, I was on the phone with the doctors. By that Friday, they were being tested. That's how quickly I was moving, because I'm like, oh my goodness, this is another level, another layer. And it's go to, but I know we had to, because at the end of the day, we wanted to make sure that our boys were safe, being tested, and also something else that we can do to help their, progressiveness, and for them to continue to get the proper, medical attention that they needed. So we received a call by the following week, and lo and behold, their levels were very high. Then we started the next process. The Department of Health started calling, and I was ready because, again, my mind is like, the first thing I said, wait a minute, are you calling? Are you trying to get us involved with DHS? I'm like going on and on and on because I know the process. And when I broke it down to them, that I knew what you were about to say, what avenues we had to go. I just had to, let them know that, first of all, I need you to help me to help them to get to the level in the proper state to get them well. So they were tested again highly, and they didn't just do a fingerprint. They don't do a fingerprint in Philly. They actually had to get blood drawn. And they got it done twice. And one level went down and the other level was still kind of high. So we had the folks come to the house to do a sweep. It was one of the hottest days in July. They did not want to do it because it was one of the hottest days in July. And I'm like, but you need some cold water because you're not leaving my house. Until you do, what you all said you was going to do and what we had access to. And that was to do the clean sweep through the house and, come in and test for the lead and so forth and so on. And, again, if you're not on top of things, if you're not that type of person to hold their feet to the plow, you will be overwhelmed and you will not get what you need done. And they did not want to do it. They did not want to come into the home and do their job because they were sweating and falling out. And I'm like, oh my gosh, what's going on? So it's the process of what families have to go through. But again, the irreversible piece of it and the exposure that we all could, be, exposed to lead in our homes. And I just got another report that a school that's not too far from me, they're about to go through another whole sweep and get repainted over. So it's still going on. It's still going on. This is something that we're going to have to continue to deal with, but we have to continue to partnership together. We're going to have to continue to work together. We have to continue to not bow down to the masses and let them know, as parents, guardians, whatever role that you have in your community, whatever role that you have, that we have to get that message out about getting our babies tested twice by 2. And I just want to plug this book real quick. I read through this book, and I'm like, ooh, when I get back to Philly, I'm going to make sure this book is in everywhere. CHOP, St. Christopher's. I was just blown away. It's a cute little book. But when you read through it, it needs to be dropped in everybody's bag. A mom or dad or whoever, adopted family, whoever, get a copy of this book because it really blew my mind. I was like, oh my gosh, ooh. Really? Wow. So I'm putting in a plug in Philly about this book because it's awesome. And I just want to leave off of this because I didn't want it to be long and drawn out. I just want to just thank, you all for being here and for us to work together as a team, for us to continue to get the word out about how important we need to advocate for this lead. I said I ain't had no more hats to put on. I wear quite a few. But the lead is another hat that I will proudly wear to get the message out about how important it is to get tested, not only with children, but adults. You know, you can get tested as well. And continue to advocate and put out the word how important it is to let families know and let them know it's not their fault. Let them know it's not their fault. And that's what I deal with a lot of time with families that I talk to almost on a daily basis, calling about different things. They give up because they know they're going to be judged. It's a lot of work to advocate. We got to advocate for everything that we do now. You know, funding, our children, schools. We advocate everything we do just about. We advocating. And everybody that I speak to, like I said, almost on a daily, they are overwhelmed. So we really need to continue to help and support one another. Thank you.
Oh, she was great. That was great. Have your attention, please. Well, it's a real honor for me today to introduce our closing keynote speaker. She's a mentor of mine, and appreciate her passion and unwavering energy for protecting children. Our closing keynote speaker today is known to many of us in this room. Ruth Ann Norton is President and CEO of the Green and Healthy Homes Initiative, otherwise known as GHHI, a national nonprofit dedicated to eliminating childhood lead poisoning and creating healthy, safe, and energy-efficient housing. She joined the organization in 1993 and in 2009 redesigned its mission in partnership with HUD and CDC to launch the GHHI model, an innovative cross-sector framework now operating in 75 jurisdictions nationwide. Under her leadership, GHHI has become a leading authority on healthy housing and its impact on health, racial equity, climate, and social determinants of health. An expert on lead poisoning, prevention, and healthy housing policy, Ruth Ann is credited by 6 governors with helping reduce childhood lead poisoning in Maryland by 99.6%. She has designed 53 pieces of state-led and healthy housing legislation that have been passed and served as principal or co-principal in over 50 federally funded programs. She has also co-authored 2 Yale Journal of Health Policy, Law, and Ethics publications on national lead poisoning prevention strategies. And Ruth Ann has raised more than $650 million in public and private sector funding to support integrated housing and health initiatives, including pioneering work on healthcare investments in housing and social impact financing models. Please give me a warm welcome.
Thanks to Meredith for the music, for all my Philly folks, right? And Tiger, I wanted to play on your Boogeyman, which was like the dog's favorite song. But I am so glad to be with you today. And 2 years ago, I joined the Lead Free Promise Project to talk about where we were. And who knew where we would be today? First, I want to say thank you to all of you who are navigating, surfing, and standing up to where we are in this country today. And regardless of your politics, it's a tough environment. But regardless of anyone's politics, families at their core don't care about all the noise that is coming out of Washington. They don't care that people are trying to tell us that Tylenol causes, 1,000 things, right? What they care about is where they live. What will become of their children? Where is the future for them in this? And it all starts at their home. And for most of that here, it starts with each of you. And it really is important in this moment to be in Lancaster, because we are in a place where an institution came together with its community to say, not what's going to save us money, but what can we do to invest that our children will be better, that they will get to the classroom healthy and ready to learn, that they will be able to be in society without disruption, that they'll be able to learn, earn, and compete for a lifetime. So I think it's really awe-inspiring to think about the Board of Trustees, to think about the staff at the Lancaster General Health, now UPenn for the past 10 years, right? Of that decision, because you can decide to go upstream in healthcare, and you can decide to invest in things like asthma reduction or injury prevention, and you know, I'm an economist by training, so we know that what we invest in those measures will save actual dollars, not only people. That doesn't happen in lead. There isn't healthcare savings that happens by investing in lead, because there isn't this long treatment process. Prevention is the only cure. And LGH, to its absolute credit in leading this nation, and I don't say this because we are partners with LGH, I would say this if I was their competing healthcare system. To think forward about what it means to have community wellness and what that means. And what is really also significant in this example of Lancaster is you heard from Sorace today. I'm the one who told Rosemarie that she's a great human. And the audacity of a mayor of a town of what, 90,000? To go compete against Detroit, Houston, Baltimore, and the state of Rhode Island, the other winners of that large $10 million grant at HUD, and to say, we're going to do it. So between the city, the healthcare institution, and its citizens, in the last 3 to 5 years, they've raised $74 million to go and say, we want to reduce and eradicate the toxic legacy of lead and what it means to our families so that they can be better as we move forward. So I think there's a lot of meaning in lead-free families and the work that's happening. And more important, deciding to walk the walk. In the last 3 to 5 years, I'm not getting my years wrong here, but lead-free families has produced 745 lead-free units, the city over 500. So 1,250 units if I do my math and add, maybe round up 1 or 2, because there's a few happening, I'm sure, today. That's amazing work. And I love Philadelphia, don't love the Eagles, but I love Philadelphia. Hey, listen, you gotta have sympathy.
Get out.
Sympathy on the kids, right? You gotta have sympathy. I'm a Baltimore Ravens fan. We were supposed to win the Super Bowl, right? Yeah, we have this deal all the time. I stick with people like, Baltimore Ravens, the Orioles, they're all struggles.
You're just digging it deeper, honey.
I'm
Just let it go.
digging deeper, right? But what we have established here is truly saying we can do that. And Pittsburgh and Philadelphia, big cities, right? This is Central PA. This is a small town in America compared to many who has said we're going to fight for our children. And that's happening in Pittsburgh. It's happening in Philadelphia. I'm so glad that Philadelphia's here today. I was so inspired by the parent that we heard from earlier. Erie and Johnstown and Chester, they're all thriving communities, grantees of the Great Healthy Homes Initiative to address lead trying to do amazing things across the state. There's more amazing things to do, of course, and I want to thank our host today who put this together, the Lead-Free Promise Project, and Rosemarie and the group here. But in the many things we need to do here in Pennsylvania is truly get universal blood testing. That means that all of us need to walk ourselves to Harrisburg, to make phone calls, to be vigilant and diligent, and get 2x2 passed into law. It is what we can do. It is the control that we have, as there has been a fundamental shift that most of us don't like, from federal government washing their hands of so many important things in this country, starting with the Fair Housing Act, and we could go on, right? But what is going to be the silver lining of this moment is what matters to all of us. Lead is the only bipartisan thing happening in Washington, D.C., and I'll talk about that in a minute. But this moment will make us stronger, make us focus on those things that we need to do, like passing universal blood screening, like thinking about wonky things like the importance of code enforcement. Anybody here in code enforcement? Most unsung heroes in the world. The real moment that communities are going to have to say, we will do enforcement, right? These are important things that we can do at a state and local level, in addition to how do we get that money. But those fundamental things that fall solely on your mayors, on your county executives and commissioners, on your state government, but mostly on community, those are the actions that are fundamental to take. They're the actions that I live in Maryland, where we have moved from the #1 city in concentration of lead-poisoned children in America to not even in the top 30. Where we've achieved a 99.6% reduction in childhood lead poisoning, and we know we're not done there. We're surely not done here. I'm cheering for you to get to 100% before Maryland does. You're bigger, you're badder, you got the Eagles and the Steelers. You can do that. Do that. You have the power like no other place in the country to do it. Being #2 on this list is not good, and we can all get off that list in a hurry for our children, right? So I definitely want to thank Lead-Free Promise for that focus and diligence. I want to thank Mayor Sorace. When she talked about Xavier today, when Ursine talked about her children, I think about the young man that I was tutoring in 1992, in 1993, whose entire family had been poisoned by lead. He was the tutor at a thing called the Franciscan Youth Center at St. Anne's Church in Baltimore, and was trying to get study habits moving, and couldn't do it, and couldn't figure out why. Lead was the reason, and generations of lead poisoning. These are not isolated stories. There are so many children in this country poisoned by lead that don't even know they're poisoned by lead. In all demographics, in everywhere in America, and we have a real focus and mission to end that. But the mayor has walked the walk. LGH has clearly walked the walk. And we've done something pretty cool. We've made contractors the new face of healthcare, right? Our risk assessors, the folks who are going in and replacing the windows, they are really doing that. But much has changed in America, and much remains the same. And as I said, the good news, the silver lining, is that one thing coming out of Washington is that lead is still the priority of the EPA, the CDC, and the U.S. Department of Housing and Urban Development when so much else is going by the wayside. I was honored and a little bit scared to have to go talk to Robert Kennedy Jr. to say, what the hell are you doing closing the CDC lead program, right? When every community in America cares about the brain health of their children, cares about how we do in school. To which they said, whoopsie, okay, reopen that, right? It was a mistake, maybe, right? Or the EPA, who I have to tell you, our organization has sued because we were the first nonprofit in the country who got doged. We went to court, we sued, we beat them, we got our money back, we're getting out $48 million. And they're still saying to me, we want to work with you because lead is our priority. So, okay, we can work with people within guardrails. We can work with them if they care about our kids, and they're going to productively do that. And so it is going to take vigilance to make sure what's happening is right, diligence, and our own actions to implement that, right? So we've seen the CDC come back to life. They're still funding the programs that you heard the special advisor to the health department talk about today. We're seeing EPA, who in the last minute came out with a toolkit for lead awareness week, saying that lead is important. And I know that I currently serve on the Children's Health Protection Advisory Council of EPA, and it is the one thing that they're listening. So let's drive a truck through that. Let's keep on that path there. HUD is keeping their lead grants going, and we should all thank Matt Emmon, who's at the U.S. Department of Housing and Urban Development, for keeping the focus on that. But we can't rely solely on the federal government. We have to find other ways, because we can't, I don't think anybody wants to count in Washington or count on politics. We have to count on what we know. We have to count on what we can do, what we can leverage to advance health equity. As Dr. Martin said, to think about not only how do we eradicate lead, but how in a world with such a division between the wealthy and the rest of us, are we going to try to eradicate poverty? We all have a common journey in this life. We certainly all have a common end, regardless of what one may believe is after that. And why wouldn't we? Be kind? Why wouldn't we be diligent? And why wouldn't we want to make it better for everyone in this life, to make sure everybody has the opportunity to contribute, to be brilliant, and that we, all of us, benefit from that. We don't have to be reminded that there's still 34.6 million homes that families wake up every day faced with lead hazards, faced with issues around asthma and injury and extreme heat and extreme cold. And they're all linked. All of the weatherization programs that we have to do in America, you can't do unless you remove the lead. When a home expands because of heat and contracts because of cold, it causes the paint to chip, right? All of it is interlinked to what we have to do and how we have to move forward. And as I said, families don't care about what's going on in the noise. They care about what we can do together. So families have an obligation, right, to be involved in this. We need to engage and educate. They've got to ask for testing. They need to tap the resources that you're offering that are out there. But we have to do that in ways that they can believe in, and we have to establish the trust that they believe in us. And we have to continue to innovate of what we are going to do. We have to think about how we're going to use pathways. So let's talk about what some of those pathways are. as people continue to endeavor on things that we know will be critically important when you have an affordable housing crisis, when you have inflation continuing, when you don't know where interest rates are, all of the things that we're hearing about, and when what I think everyone knows who's sitting and watching all of the politics of Washington, if you thought 2025 has been rough, 2026 will be rougher because people who want to retain that power are going to do more of what they've done and go against communities they may not want to help, which includes the poor. So how do we think forward in that moment? Healthcare is one. LGH should not be the only hospital in America standing up a program to do what it's doing. The Cleveland Clinic, inspired by LGH, we had the president of LGH come down to talk to the HUD secretary under President Biden, and he told all about the $50 million investment. The secretary got on the plane, flew to her own town of Cleveland. Cleveland Clinic put $52 million into their city, inspired by what's happening here in Pennsylvania. But big institutions have to step up. But it's not just hospitals. Medicaid managed care has administrative dollars. They have other inspiration to do this. And all of you who sit in community health needs assessment cycles every 3 years, we all know housing is the #1 issue for families that they are asking healthcare to help them with. So we need to be engaging our Medicaid managed care organizations. We need to be inspiring others to think about where they are. I mean, interestingly, GHHI sits in 2 hospitals. Here at LGH as a partner and a subcontractor to the hospital, but also at Le Bonheur Children's Hospital in Memphis. But there should be more of us in hospitals across America partnering up. And we ought to be thinking about it, wherever it's a children's health shop in Philadelphia or across the state, thinking about what we're doing and thinking about the innovative things that systems like WellPoint, Blue Cross, what we saw today on other programs that are really moving forward on Medicaid managed care investments. But if you're also not talking to your banks, you should be doing that. We co-run the Detroit Home Repair Program. Home repair will help save us, by the way, on the issue of lead. But we do this in Detroit. It's fully funded by philanthropy and banks that are working in Detroit to change the future of health and housing. JP Morgan Chase is putting tens of millions of dollars in to Detroit. So is the Gilbert Family Foundation. Think Quicken Loans, right? Rocket Mortgage. They fund that work for the 14,000 people on our pipeline that we're going to be getting to and making properties safer for lead and safer for other issues like mold, mildew, and moisture. But PNC, anchored here in Pennsylvania, has a goal of racial equity, social determinants, health, and healthy housing. They're investing monies across their systems, and you ought to be asking them to be at the table. All of your banks represent this opportunity, not only through Community Reinvestment Act, but as the affordable housing crisis comes, as job challenges come, they have mortgages on many of the homes that are suffering. You have a pathway to help them. And they need to be stewards around what we're doing, including supporting good policies. Corporate foundations have a place in this too. If mom or dad are caring for a lead-poisoned child, they're not at work. They're likely moving. They're turning over their property. They're being challenged by other things. And the workforce of the future is going to be ill-equipped if they're lead poisoned. And corporate foundations have a role in this, along with philanthropy. The case today is about the basic things that we need for families to survive, to thrive, to be stable, and to increase affordability. And the work that you're doing, done well, closes the racial gaps around housing appraisals, starts to build wealth, retention for families, and intergenerational wealth transfer that starts to level the playing field. So really important work. For many of you who are in the work of actually eradicating these hazards, if you're a nonprofit, an institution doing this, fee-for-service work is also a way to build some level of profit and reinvest back. We're trying to support, through our Thriving Communities work, organizations, institutions, even cities who are thinking about how to tap in to the families of greatest need through grants, and how to go for fee-for-service to those that are just above that line who can contribute some and put reinvestment back in there. Sorry about whatever I'm doing here. But as I said, get to know your local home repair programs, get to know your local code enforcement folks, and have the ability, maybe the courage, to stand up in your community and say that enforcement of standards matter. It is 95% for us in Maryland. Enforcing the standards is what got us to 96%. The enforcement side, knowing that if you don't play by the rules, there's a penalty. So in Maryland, one of the things we did is we have a state law. It's called the Lead Risk Reduction in Housing Law, the least unsexy thing, or the least sexy title in the world. But the reality is, if you don't comply with that for rental housing, if you don't remove the hazards, pass a visual, pass a dust, visual-only inspections don't work. They don't work. Kids will be poisoned. You gotta test. You gotta make sure you're doing the dust test and doing the right risk assessments. But if you don't follow those rules in Maryland, you may not collect rent. It's an illegal rental. Families can go to court, the rent will be stopped, you'll be ordered to do the cleanup, but you lose your right to housing court and you lose your right to rent collection if you're not coming with clean hands, which means follow the law. And so thinking about how do you strengthen those things at a local level? And it is doing really important and miraculous things. And we really thank Philadelphia, who, by the way, copied the Maryland law and has put some of these things into place, not that last piece of the law yet, but is doing the annual inspections, and we're getting properties registered and we're getting them inspected. But there is a time for a call to action now, making the case to philanthropy about the long game, making the case to your local employers, to corporate philanthropy, to thinking about how you bring in not only healthcare, but your utilities. Every utility fund, to accomplish what they want to do, and every state has their public service commissions or their utility boards, funds that are going out to make homes more energy efficient, which you cannot do if there's lead. Weatherization programs will be declined if there is lead. So it's in the books. They will defer and decline. It happens 52% of the time in the United States, sometimes higher in many of our cities. So go to those utility boards. Be known about what you're doing there. There are tools everywhere, even if you have to look into the couch cushions to find the money. to do that. Developing donor-advised funds at your local community foundation around lead, tying it to education, tying it to better outcomes on juvenile justice. These are the important things that community foundations are there for. And I gotta give a bit of praise to the William Penn Foundation in Philadelphia, who's matching the dollars that we're giving in thriving communities. If you're a Philadelphia grantee of ours, they're giving you extra money. So to the end of that, I will also put a brief announcement out to say, we still got $20-some million to give away out of thriving communities. It's not money we can keep. It is all about getting it out the door. If you need help in your local programs around lead, it's one of the top things we're looking to fund. In Region 3, which means Pennsylvania, go to thrivingcommunities@ghhi.org. Ask for an appointment. We'll tell you how to apply, whether it's $75,000 for organizations that are resource depleted, starting up, $150,000 for assessment, $250,000 for planning, $350,000 for implementation. We are trying to give the money out fast because we beat the folks in court, but they're going to appeal, and it'll go, if we win, if the appeal is upheld and we stay in good shape, they're still going to go to the Supreme Court and we're likely to lose, so we have to get the money out faster. We'll do it right, we'll do it by the book, but we want to do it. But there's lots of opportunities here. And you should be talking to your local housing departments around their home repair programs, around their weatherization programs, your local utilities. But we really must think about this. It's also critical today that we unify. Not compete, but unify. If you cannot unify and you cannot partner in this environment, shame on you, right? It's like we have got to be together on what we have to do together. So I hope that what we can do in the end is document the need, document the work, show the progress, and continue to make the case. Because today we're winning that bipartisan support. It's a tougher environment. It's a bigger wave to push back. But we're still winning. And we're winning on it because on this issue, it is so provable. If you do the right things in education, awareness and education, and you implement that into action of doing root cause remediation, the result is children will not get poisoned, and that result is worth billions every year to the federal government. We spend $50 billion a year on kids who are poisoned. Think about what our communities would be like if that $50 billion came back to us. But the reality is, when we prevent lead poisoning, we are getting $50 billion 3 times over back to our communities in opportunity, in earnings for the future generations. So let me just say, upstream is also important before I get out of here. Going upstream. Dr. Martin talked today about thinking about getting pregnant women tested, paying attention before a child is born. Programs that are doing that and are able to do it. Think about what if we don't do that. There's a 20-year longitudinal study out of Rutgers and Hopkins that's been going on in New Jersey. And what they know is that of newborn babies, 13.6% of babies screened at the University Hospital in Newark were born with high lead exposure. Born with. Think about the future for that child. Babies exposed to lead at that level are coming out with levels around 34 micrograms milligrams per deciliter. Okay? And if we continue to allow that to happen, that's at least 13% of children in Newark and probably around the country that we know will have behavioral problems, motor skill problems, cognition, before they've ever started. We have an opportunity here to ensure that every child meets their full potential.
No, I'm good, I'm good.
You're leading, you are America's heroes in what we're trying to do for the next generation. And so what is happening here in Lancaster, the great work being led by Ashley Lundy and Elizabeth Hebner and the crew at Lead-Free Families, the nation needs to pay attention to, we all need to pay attention to, and we need to do this together. So let's get the 2x2 bill passed. Let's lift up the work that's happening not only here in Lancaster, but is happening across this state that can help everyone else move forward. So I'll end this to just say thank you to my own team at GHHI. I am eternally grateful. And to thank you to each of you, because we're going to do this together. We're going to see the end of this. We are going to end the toxic legacy of lead, and we are going to allow our children and our grandchildren and generations to come to prosper and succeed because of your work. So thank you.
We just wanted to see if anybody has any questions. She's answered all of my questions, but.
The Ravens are still going to win the Super Bowl.
All right. I don't even have them on my fantasy football team, so let's. Anybody? All right. You sure?
We're good.
All right.
Thank you all.
Thank you. All right. One thing I'm going to end with, or I have a couple remarks, but to start with, as I said earlier, Janet Panning, who is our co-chair for this conference, broke her shoulder. So I want to take a quick video, and if everybody can say, "Get well, Janet." All right, 1, 2, 3. Get well, Janet. Thank you. That'll make you very happy. Okay. So, wow, what a day. We heard from local officials on the impact the lead program has for a city and county of Lancaster. We heard about the amazing people that make this happen, from grassroots to health systems. We heard from state and national leaders about the work that is being done and still needs to be done. And most importantly, we heard from our parent, Ernie, who shared her impactful story and reminds us why we do what we do every day. Before we go, though, I want to make a few minutes to thank some other very important people. First, Khan and Raja, stand up. Who made so many details about today seem easy, and for keeping Janet and I on track and on time. A huge thank you to the Lancaster Conference Committee, who were critical in planning today. So I'd like to call out Elizabeth Hibner, and can you guys just wait for them? Darren Farmer, Leah Schermeyer, Craig Walt, Elaine Ish, Meredith Laston. Thank you so much. They spent countless hours with us planning this conference over the last 6 months, and all your great ideas and assistance with the venues, speakers, and logistics made today a success. And we also wanted to especially thank the volunteers from Penn Medicine who took time out of their busy work day to come and help us set up last night and today. So that was a huge help for us. And we also wanted to thank our partners at the Pennsylvania Department of Health, especially Shonda Mayo, for always being available to answer our questions and provide support.
There were supposed to be 10 of them here today, but because Pennsylvania does not have a budget, they were not allowed to travel. So they were very disappointed in this thing today, but we're filled them in. And then I wanted to recognize Gail Gittins again, who traveled from New Hampshire, and she's the author of the Happy, Healthy, Lead-Free People, which if you haven't seen it by now, I highly recommend getting it for your community. And then finally, thank you all for taking the time out of your busy schedules to learn, network, and hopefully be empowered to return to your work with a fresh vision, inspiration, and unity for this issue. It's challenging times right now for public health and the community organizations, but as Gandhi said, be the change that you wish to see in the world. You all have inspired me to be that change. So thanks, and safe journey home, and that's it.